Good morning, everyone. Welcome you all to the third day of Bharat Nutrition Week, a 7 day long virtual initiative to support the nation's mission against malnutrition and building a Swasth and Ayushman Bharat. This is also to strengthen the spirit of World Nutrition Week and Rashtriya Poshan Maah of nutrition in our health, in our life. This mega conclave aims to strengthen the public participation for embracing healthy food habits as well as bring all stakeholders of health, food, and economic growth to look into the nutrition paradox that we face in a more holistic manner. I am Kamal Narayan, CEO of ISW Council, which is a not for profit social impact institution promoting health for all. Before I go ahead with today's session, I would request my team to play an AV on ISW Council's work and its mission.
Conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है.
Exceptional contribution to health space has also been recognized through such initiatives. These forums also received an overwhelming response from the industry. Several legendary brands have come out to support these efforts and have become the real change agents. In its efforts to make health a priority, IHW Council is committed to the making of a healthier India. Global health hazard, economy and social uncertainties due to COVID-19 pandemic made us more firm and responsible in our ideology. And we immediately felt the need of taking our efforts to the masses through web and launched the landmark initiatives through our social media handles. Over the past 4 months, we have hosted many virtual summits, talk shows and symposiums, mega movements and reached out to millions of audiences online through our extensive promotion on social media and digital space. IHW Council, always welcoming the like-minded companies, social organizations and individuals engaged meaningfully in uplifting people, communities and societies. Let's join the movement for people to get their basic birthright: clean air, clean water, good food and good health, and help in making Bharat a healthy nation.
Thank you. So the last 2 days of Bharat Nutrition Week witnessed thought-provoking insights on how can we mobilize and fortify our collective efforts to holistic nutrition for good health of the humanity that lives in India, while also ensuring that we are able to address the nutrition that entails sufferings from extremes of two words, where both hunger and overeating are leading to diseases and death. Yesterday was also a historic day as key health impact makers of our country, such as Foxy, which represents around 35,000 gynecologists across the country, MCure, Artist, Nandghar from Vedanta Limited, all came together to join hands with ISW Council to launch a new initiative called Sapath for working towards an anemia Mukt Bharat in a focused and time-bound manner. We are also very excited that the encouraging participation we are seeing in our question quiz contest to engage and educate school kids on healthy food habits and nutritional wisdom. This is in line with the idea mooted by the Prime Minister Narendra Modi in his Mann Ki Baat address recently. I would request my team to play a small AV on what happened in the first 2 days of Bharat Nutrition Week. Give the unprecedented voice to the cause of women health and to bring it to the center stage of our national nutrition narrative. We have with us today some of the most passionate champions of women health and well-being.
Nutrition is indeed connected with good air, good sanitation, good water, good health, and we are bringing the whole issue together. And खाने में दम है.
यौवन बीमारी से मुक्त करने के लिए हमें ठीक डाइट मिलना चाहिए और अपने देश के लिए हम काम करते रहे, अपने फैमिली के लिए काम करते रहे. मैं इस कार्यक्रम के लिए IHW काउंसिल को धन्यवाद देता हूं.
Only a holistic approach to nutrition, and I am glad this week is focusing on holistic approach. Then only we can achieve the target.
If we are weak, if we are sick, we're not going to be able to fulfill our dharma. We're not going to be able to do anything. चाहे परिवार के लिए, चाहे समाज के लिए, चाहे देश के लिए, चाहे विश्व के लिए. So I'm so happy to see us all coming together for this Nutrition Week.
Can we continuously talk about the same thing? The answer is yes, till we actually don't make it.
Yep.
Free. Till we don't have holistic health for women.
We have to really invest early if we wanted to address anemia. And anemia doesn't work in silos. We need to work on women's nutrition. We need to work on women's empowerment and aspects like age of marriage. This is the right moment. If not now, when we will have it.
So here we can teach, one nurse in particular hospital or PHC, who can take care of the mother? It's like
Okay.
teach one and they can teach thousands.
The studies show that when a woman eats healthy, everyone in her household is more likely to eat healthy.
We should treat our body as a temple, and if we are fit, we can take care of our family members, we can take care of our society. At the end, we say that each one teach one.
If we change the mindset like that, we're not going to compromise on our health, on our kids' health, on our family's health. Once that conscious decision has been made, then I'm sure we'll find all the solutions. It's not going to be difficult.
Let us see how much our next generation knows about this vitamin.
Oh, yes.
All right.
Great. What is the function of vitamin C? Is it the formation of collagen? B, is it neural function? C, protein metabolism? Or D, hormone synthesis?
I think it is
I
A.
think A.
The answer is indeed A. Correct.
Absolutely correct. It was great playing with all of you today, and we will see you tomorrow for our third day.
First recipe is a roasted tomato, carrot and garlic soup, which is beautiful because I've also added some olive oil, basil, parsley, herbs and a lot of things to it to make it a one meal soup. You enjoyed both our recipes today. It was lovely being a part of this live session.
American social reformist Frederick Douglass had said, "It is easier to build strong children than to repair broken men." The statement powerfully highlights importance of investing in our children to help them become good adults. And the first and foremost thing that we can ensure for our children is good health that can help grow a sound body and sound mind. However, India faces a serious crisis when it comes to the health of our children. And at the core of it lies the widespread problem of malnutrition. Malnutrition among our children, that is the theme of the day which we are going to discuss. India is a home of the largest number of children in the world, and that unfortunately translates into having maximum number of malnourished children in our country. This is definitely a big impediment in reaching to the SDG goals that the government has committed in the global community. To understand what are the challenges our nation facing when it comes to every 7 decades of independence, and despite the fact that now we are the food surplus country with among the largest producer of most dairy products, fruits and vegetables. Our very distinguished panelists today in the inaugural session of the third day of Bharat Nutrition Week, Dr. Jagmeet Madan, an eminent nutritionist, national president of India Dietetic Association, and is the principal and professor of Department of Food, Nutrition and Dietetics at Sir Vithaldas Thackeray College, of Home Science, SNDT Women's University in Mumbai. She has been an avid researcher, and her area of interest include childhood obesity, body composition of school-going children, adolescents, and its relationship with the diet and lifestyle factors. And also she has done remarkable work in the area of macronutrient sufficiency among Indian population and its role in public health outcomes. We also have with us Dr. A. Lakshmaya, scientist and head public health ICMR, National Institute of Nutrition. Dr. Lakshmaya is an epidemiologist and public health nutrition specialist in the Division of Community Studies. He has been researching extensively in the areas of public health nutrition. He is the execution in charge for activities of the National Nutrition Monitoring Bureau and serves an advisory committee member in health and nutrition for reputed government bodies like the Department of Science and Technology and Midday Meal Program. We also have with us Dr. Ajay Khera, country representative of Engender Health India. Dr. Khera is one of the most famous name in the area of public health in our country. Dr. Khera has served over a decade as Commissioner and Public Health Specialist for Reproductive, Maternal, Newborn Child and Adolescent Health Program of Government of India. He has been closely associated with polio eradication and national vaccine policy. He worked as an epidemiologist in the Sultanate of Oman and as a WHO consultant in Myanmar. He also contributed in developing the strategy on early childhood development and quality of care around childbirth. Dr. Khera has been instrumental in completion of India's first ever nationally representative nutrition survey of children and adolescents in India, the Comprehensive National Nutrition Survey, CNNS. The survey is the most robust and was the largest micronutrient survey ever implemented globally. Welcome, Dr. Khera, Dr. Lakshmaya, and Dr. Madan. We also have with us Mr. Ravi Bhatnagar, Director of External Affairs and Partnership, Asia and Middle East of South Asia for Reckitt Benckiser. Ravi is a global public health and global public affairs professional who currently heads the external affairs in RB. He's also among the most influential health communicators in the country and has been the driving force behind some of the most remarkable public health hygiene awareness campaigns such as Detol Banega Swachh India and Detol Banega Swachh Bharat. Swasth Bharat. He is also leading another major project of RB Nutrition India program, an innovative digital and artificial intelligence based project which aims to enhance health, hygiene and nutrition for pregnant women and children and give the best start in the first 1,000 days. We also have with us a very special guest from New York, Dr. Ashish Atreja, Chief Strategy Officer, RX Health, and Associate Professor and Chief Innovative Officer, Medicine, Icahn School of Medicine at Mount Sinai, New York. Dr. Atreja is a healthcare executive and entrepreneur with a board certification in internal medicine, gastroenterology, and clinical informatics. As Chief Innovative Officer, Medicine, he established Sinai App Lab in 2012, which was the first innovation hub within an academic medical center in US to build the test disruptive digital health technology. Dr. Atreja also serves as a scientific founder for Mount Sinai spin out RX Health with a mission to democratize and prescribe digital health globally. So thank you so much, all our speakers, for our audience to understand and know better about you. I would like to begin today's discussion with, and I would like to go to Dr. Ajay Khera first on this. Dr. Khera, you have been involved, for over a decade. You have been very, very extensively working in the area of understanding the malnutrition problem in India, in a manner which was one of its kind, unique in the. What is the state of nutrition in India, and what are the biggest challenges we are facing as a country?
And you, with your expertise, and your work, I'm sure you will be able to tell us that what are the larger picture which we need to deal with, Dr. Khera.
Yeah, so first of all, thank you very much, Mr. Kamal Narayan, for the introduction, and greetings to all of you on behalf of the Engender Health. And I will also at the outset like to wish you the best of Bharat Nutrition Week, a kind of a program which you have initiated. And today we are talking about malnutrition situation, and we also talking about what are those various interventions which are being put in place in order to address the huge burden of malnutrition. Just to give you a bigger picture, in India, the problem of malnutrition is so huge, and we continue to say that every third child in the country is malnourished. It's a huge problem. Every year, around 25 million children are being born every year. And if we consider up till 5 years of children, which are around 125 million in number, around more than 30% children are undernourished. That's number one situation. And then the second important thing, big picture is that beside undernutrition, there is something called as the anemia. Because anemia and undernutrition, they also move simultaneously. And the problem of anemia is so huge, and the burden is to the extent that every alternate child in the country is anemic. So you can understand the burden. Every third child is undernourished. Every second child is anemic. So, and these problems of malnutrition, I mean, they are all linked with not only with survival, they are also linked with the overall development of a child. Now, as you know that India has an infant mortality rate of around 32, and where around 8 lakh children die every year. And if we try to do a critical analysis, you will be shocked to know that 50% of the child mortality is in the backdrop of malnutrition. Malnutrition per se may not be killing children, but the backdrop of malnutrition leads to lot of deaths of children, because a child with malnutrition, if gets a bout of diarrhea, child dies. If a child with malnutrition gets a bout of pneumonia, child dies, but the healthy child may not die. So more than 50% of the child mortality is attributed to in the backdrop of undernutrition. And also the anemia situation is so huge, it also is leading to a lot of kind of a weakness, inefficiencies in the system. Now, in order to address this huge burden of the undernutrition and anemia, the government of India, under the able leadership of the Honorable Prime Minister, started a big abhiyan, which is called as the Poshan Abhiyan, and where we have put ambitious target of reducing the undernutrition by 2% per year. And if you look at historically, we have been reducing undernutrition by less than 1% per year. So ambitious targets have been kept. Now, in order to achieve those ambitious targets, something special out of box needs to be done. Now, in order to, what are the actions which are required to be done? And one of the important thing is there is a lack of awareness, and lack of awareness is one of the major impediment in terms of addressing the problem of undernutrition. And there is something called as the 1000 day. 1000 day is a critical period, and 1000 day implies first the 9 months of the pregnancy, the day the child is conceived, the 9 months of pregnancy, and then we have the rest of the days up till 2 years of age. So these are supposed to be the critical period, because we have seen in India around 20 to 25% children which are born in the country are low birth weight. Now, low birth weight, if the child is born as low birth weight, child will remain undernourished. So if you really want to address the issue of low birth weight, you have to address so-called the 1000 day window. That means quality antenatal care is to be provided. Good food is to be provided during pregnancy. Regular checkup of the pregnant woman has to be carried out. And that's why Government of India has come up with a variety of programs, where we are ensuring, kind of a free checkup of all antenatal mothers. We are ensuring free delivery of the mother. So first 1,000 days really critical in order to address undernutrition. Now within 1,000 days, it is not only the period of antenatal and intrapartum period. The interesting part is, feeding practices. Now there are a lot of kind of, awareness gaps in the population in terms of understanding the knowledge about the feeding, like breastfeeding. And you'll be shocked to know that only 50% of the mothers in the country are in a position to breastfeed their children. Why? Because they are not fully aware that breastfeeding is such an important intervention which can really help in improving the nutrition level of the children. And to improve breastfeeding practices, there need to be awareness of the mother, and somebody has to support the mother, somebody has to counsel the mother. And there is something called as, we have to protect, the breastfeeding. So there are a number of, critical principles which has to be promoted in order to encourage breastfeeding. And then the third important awareness point, which I want to highlight at this point of time, is something, which is very disturbing in the country, which is leading to huge burden of malnutrition, and that is called as the poor complementary feeding. At 6 months of age, the child has to be started a complementary feeding, and we recently did that, with the reference to the Comprehensive Nation Nutrition Survey or Nation Family Health Survey. They indicate that the less than 10% of the mothers are giving right quantity and right quality of the food at the age of 6 months. So complementary feeding is a major challenge in the country. 90% are poorly, doing a complementary feeding. So that means it is not the question of availability of the food. It is more of awareness. Yes, food is important, but beside availability of the food, we also need to be aware of what kind of food, how much food is to be taken. So these are the two important areas. And the third important area I will like to flag here is, which is also very critical, is in terms of, the family size, the interval between the pregnancy. The population, the family spacing. If you have a birth of the children at a very frequent interval, you are going to give birth to a undernourished children. So that means there should be at least a gap of 3 years between the two pregnancies. And the situation in the country as on today is, 50% of the deliveries which are happening in the country, they are happening within a span of less than 3 years. Every alternate pregnancy is happening with a span of less than 3 years. I think we need to promote this practice of, pregnancy interval, promoting birth spacing, promoting family planning for the purpose of spacing, if not as a purpose of population control, but for the purpose of improving nutrition, we have to address this so-called the population and the spacing. And last but not the least is, which is not a big concern, but still an area of concern, something called as, early pregnancy or early marriages. As on today, in India, around 8% pregnancies are happening in, adolescent girls. And you can understand 8 to 10% is a huge number. Out of 25 million births happening, 2.5 million births are happening to women. Actually, baby delivering a baby. So you can understand, if an 18 or a 19-year-old girl is delivering a baby, because she is not mentally mature, she is not physically mature. So I think we need to address the issue of, early marriages and early pregnancy. And I think we need to have a war on this adolescent pregnancy. We should be able to eliminate early pregnancy in the country, So I think these are the big thoughts which I have in mind. And I think these are the issues which we need to address if we really want to improve the health, development, and survival of the children in the country. So with these few words, I stop here, and my best wishes to all of you.
Thank you so much, Dr. Chhera. I believe you are going to stay with us. We can come back after talking.
Sure.
Yeah. Okay. So let me go to. So you broadly, put forward the big numbers, which are really, kind of shocking. Every 3 out of every 3 children, we have 2 who are malnourished. They are, stunted. We are losing a lot of lives because of the, mostly because of malnutrition, which is largely attributed to that. And then you are highlighting all these aspects of
right from stopping pregnancy at adolescence to for example having the right interval between the deliveries, and also the right kind of breastfeeding practices, and also the supplementary food for the kids. So and this involves so many factors around it. I think it is a lot of social, economic, and many other aspects, behavioral aspects are involved in this. We will try to understand that as well. But Dr. Jagmeet Madan, apart from these broad understanding of underweight, stunted, wasted, what are the other hidden hungers or malnutrition which we are facing in our kids, especially of micronutrients, macronutrients, and how much it is playing a role in the health and their productivity?
So at the outset, I bring greetings from Indian Dietetic Association and Sir Vittal Das Thakursi College of Home Science, SNDT Women's University, Mumbai. Thank you, Integrated Health and Wellbeing Council, for giving this opportunity, and Mr. Kamal. I think right at the beginning, I would congratulate Mr. Khera, especially, because as a nutritionist fraternity today, we are very much heartened that nutrition today is a national will, or optimum nutrition is a national will. And when things trickle from central conviction and belief down the order, I think success is inevitable. So that is where I, first of all, express my gratitude to the national government to have taken nutrition as the center stage agenda in the country and engage with all stakeholders who are responsible to deliver, nation's well-being, and across the age group, across the socioeconomic strata. To my mind, the most important group which really needs to be addressed is our infants, young children, adolescents, and I would go one step further to say even young adults. So every step has a significance and every step is interrelated. So what Mr. Khera said, that starting from preconception to the entire stage of pregnancy, to the lactation, to the first year of child's growth, or first 2 years of child's growth, at every stage the right kind of nutrition intervention is important, because these things are not compartmentalized. They are all interlinked together. And we all know that any insult done during pregnancy has repercussions in the later stage, starting from early childhood to young children and adolescents. I have been working in the field of child nutrition, infant and child nutrition, for almost more than a decade. And I worked a lot with young children, adolescents. And what is most concerning is that way back in 2008-10, when we did a huge multicentric project, which was spearled by Dr. Anup Mishra, MARG, and we covered more than 10,000 school-going children from government and private school from Mumbai. This I'm talking in the year, 2008 and 10. We found that there is a dual burden of malnutrition. On one side, there is overweight and obesity. On the other side, there is gross undernutrition. But the ironical thing was that at both ends of the spectrum, whether it is high socioeconomic strata or low socioeconomic strata, it was the quality of food which was compromised. And very rightly put up by our eminent panelists, that the basic cause of compromising on the quality was not only the affordability, but the ignorance. And that is where from then onwards, we took this thread forward towards the mandate of nutrition education. We went one step further to identify what is happening internally to these children. And you'll be surprised to know that children with normal BMI, low BMI carried high body fat percentage. We went one step further to link that with the dietary and lifestyle practices. And again, you will be heartened to hear that there was a direct correlation between the quality of eating and the body composition which the child has. So today, what we are addressing is not only compromised, compromised state of nutrition during pregnancy, during lactation, or during first 1,000 years, but I think what is most alarming is that we have children who are apparently looking healthy, normal, but still carrying a lot of inflammation in the body. And inflammation means excess of body fat, which is getting directly correlated to the eating habits which they have, the kind of lifestyle factors which they are engaged in. I would like to share our recent work where we have screened 1,300 adolescents and young adults in the city of Mumbai, starting from 16 years to 25 years. You will be astonished to hear that more than 30% of these kids are at risk to pre-diabetes. They have hyperinsulinemia already floating within the body. And to look at, these kids are absolutely normal, So what I'm trying to point out is that the problem is really grim, severe. And in addition to undernutrition and overnutrition, what you said is we also have hidden hunger of micronutrient malnutrition. Because very often our attention just focuses around the macronutrients, but I think micronutrient malnutrition is also becoming rampant because it gets compromised with the quality of diet, with the dietary diversity. But the good news is that as a nutritionist, I vouch for a food-based approach. And I talk on behalf of the entire fraternity that we have actually experimented it. And we have used a food-based approach in our recent work, and we have found that just by altering the kind of snack which our adolescents or young adults are consuming over a defined period of time, we can bring about changes in their internal environment. We can bring about a decrease in their body fat. We can bring about a decrease in their inflammatory markers in the body. And, these are very heartening threads which we are getting. So again, as a scientist today, we want to talk evidence-based, facts. So we get these evidence from these little work which we have done. And today, as the National President of Indian Diabetic Association, we are working very closely with the government. And, we are an extremely integral part of the Eat Right India initiative, and are, working at all levels, whether it is creating resources, whether it is reaching out every stakeholder, which is
Dr. Madan,
and we are working very closely with them.
I will come back to you on more details about how you are trying to actually bring the right interventions to the communities and the people around you. Let me go to Dr. Lakshmaiah first. And Dr. Lakshmaiah, as Dr. Jagmeet Madan also highlighted that, while we are looking at those, the broad, aspects of undernutrition, the malnutrition among the children, this, ever increasing number of over-nutrized or wrongly nutrized, children, which is around 14 million, I think, obese children we have reported to have in our country. Dr. Lakshmaiah, how your institution like NIN is working and ensuring that at all level, not only awareness, but at the policy, but also how we are going to make sure that the right kind of food choices are going to reach to the people, and they are the right kind of food being made available or promoted. What is the role NIN is playing in this?
Thank you for inviting Kamal and other committee members and other experts, especially Professor Jagmeet Madan and Ajay Kera, then other dignitaries. So good morning, all of you. So this is actually your topic is the healthy children and healthy nation is a very opted subject. It is a very nice subject, and it is true also, because without health of the children, the nation cannot be healthy, because today children, tomorrow's leaders. So the healthy children is very, very important. As previous speakers already discussed at length about undernutrition and micronutrient malnutrition, and actually I can say that it is a triple burden of disease. India is facing triple burden of disease. One is undernutrition and hidden hunger, then NCDs, non-communicable disease, extensively non-communicable disease prevalence also going on, especially and in all sections of the population. Even we have extensively studied, we have conducted large epidemiological studies on tribal population, rural population, even urban population. And we surprisingly, we noted that even among tribal population, the overweight, obesity and hypertension, even every one fifth of person is suffering from hypertension even in tribal population. So all this leading to unhealthy population, and the even burden on the burden of the even at the country level, the health burden is increasing. So this all to curtain all this unhealthy population, the best choice is we have to take at childhood age itself. And we are living in a vicious cycle of even obesity. Obesity is also a vicious cycle, because even infection is also a vicious cycle. Infection and malnutrition, then obesity is also a vicious cycle, and it starts with childhood. Even several studies also proved that if the presence of overweight obesity during childhood, 77% of children is likely to carry it over in the adulthood. So the better option is we have to prevent it the childhood itself, the overweight obesity, and overweight obesity leading to even several consequences. The battery of consequences. It may lead to insulin resistance, diabetes, hypertension, cardiovascular diseases, and sleep apnea, and several complications. This leading to. But what is the reason? This is the reason could be the unhealthy food habits, because we have done several studies on unhealthy food habits, and and previously, and 10 years back and 10-20 years back, and now we compare to our dietary pattern is totally changed. So we are almost forgotten our traditional diet. So we habituated on modern diet and very unhealthy diet. And recent survey shows that about 35% of population, at least at least 3 days they are consuming processed food in a week. So that is the scenario of now present consumption of unhealthy diet. So all these reasons, because as Professor Madan also said, and even Kara also said, that this is not because of lack of food. This is not because of poverty. All this happen. It is because of ignorance. So the even literate people also illiterate in nutrition knowledge. So that's what every time we used to observe. Even they are literate, but nutrition point of view. So most of the people, they may not know what to eat, what quantity, and what quality of food. These three things are important: quantity, quality, and frequency. So the selection of food is also important. And we have done one beautiful analysis, the intra-family distribution of even foods, intra-family distribution of nutrients, how much calories are distributed within the family, how much vitamins are distributed in the family, how much fat is distributed within the family. And surprisingly, suppose if you undernutrition, if you taken place, if you discuss, and the same energy is meeting parents, energy requirement is meeting in parents, and whereas in children they are not meeting energy. So that we cannot say that parents are eating for the portion of the children, but it is ignorance, because how much they have to feed to the children, how many frequencies they can feed the children, those kind of issues they don't know. Even IYCF, we have extensively done IYCF practices evaluation. At district level, we have done even 8 states, all districts, more than 150 districts we have evaluated. And there are some very shocking news coming from even this dietary intakes, and even complementary initiation of complementary feeding process practices, and especially the quality of diet. The quality of diet also not good, because adequacy diet. So adequacy diet, even NFHS survey shows that only 6% of children are eating adequacy of diet. So not only adequacy, and another issue is we are also discussing with the dietary diversity, very poor in dietary diversity. Suppose we have 10 food groups are there. Out of 10 food groups, every person should eat at least daily 8 food groups out of 10 food groups. But in rural area, we observed only most of the people are eating only 4 food groups and 4 to 5 food groups only. In urban area, 6 to 7 food groups. But even in urban area also, the adequate diet and the dietary diversity achieved only 24% of the population. Recently, we have sent for publication these things. So in that case, because for control of undernutrition, control of hidden hunger, and control of NCDs, we have several programs are there. Even national programs are available. So we need not start a new program, but our programs are well designed and objectives are well targeted. But only we are failing in implementation, coverage, and some of the programs we are not even reaching to the public, and the public they may not knowing what are the programs available and what are the inputs we can get from those programs. Those issues also there. So then there is a lot of need in a program awareness, creation of program awareness. What are the programs are there? What are the beneficiaries? Who are the beneficiaries? And what benefit we can get? And if we are coming to the obesity, but here only the obesity, I already told you, it is a vicious cycle. It is starting with from birth itself. Starting from
Dr. Lakshmaya, yes, I would like to take forward the discussion, from your point about, I think the large of the, mostly the problems which you are highlighted are kindly being attributed towards the unawareness and lack of, awareness or literacy around nutrition. So let me go to Ravi on this. And Ravi, you have been, leading some of the, I think a very, very impactful awareness campaigns, activities, behavioral change. And I think, the triple burden which Dr. Lakshmaya is highlighting, malnutrition, undernutrition, and then, the hidden hunger and that ever-growing NCD burden in our country. And all three are being connected with the wrong food habits. And the wrong food habits is being connected with the, the lack of awareness. Illiteracy, as Dr. Lakshmaya said, that even the literate are illiterate. How you see, as a communication professional, as a public affairs professional, and somebody who has been working on this area, how do you achieve this outcome where you can really make some behavioral changes? And I see that you are very, very enthusiastic, about technology, role of AI and multiple other things. How do we use them and actually make the impact, make the behavioral changes?
First of all, thank you, Kamal, and thanks to IHW for calling me to this particular very interesting discussion. And I'm very proud to be associated with you guys, because the kind of work you guys put together is of next level. Now I have heard Dr. Khera, I have heard 2 other speakers also. It's amazing the way the discussion is flowing. I have certain points which I would like to add before I reply to your particular question, Kamalji. The first thing is a lot of data is all quantitative data which is available. A lot of data is obsolete in nature, There's a lot of data every day when things happen. There needs to be some systems. People talk about the HMIS, people talk about NFHS, people talk about census, people talk about other surveys, etc., etc. That's purely cool. They should all go in. What's more important is basically when was the last ethnography done with the communities who are really, really at the bottom of pyramid on the nutrition outcomes? When was the last ethnography done? When did the anthropologists last visited these communities and came out with certain suggestions and recommendations? It all happens at a very, very small level, at the project level, when someone invests the money from the CSR kitty, or some international grants are given to NGOs like XYZ. Will not name the NGOs. So India is a country. If I tell you, which has various countries inside India. Like, why I'm saying this, UP itself is equal to UK in terms of size and everything. In terms of population, it's 3 times more. But the problems which are there in UP or Bihar, like you have the Musars, you have the rat eaters, you have the Mahadalits there. What's happening to the nutrition outcomes there? What are the pathways to reach there? Is it only food? Is it only nutrition supplements, or it's only nutrition which will help? Or there are some aided, interventions, like wash interventions, like interventions like food diversity on intake of food. Then the food consumption habits. What's happening in India on migration? A lot of people in the tribal regions migrate from one place to another. So for around 3 to 4 months, they get some services from the frontline health workers, either from the NGOs or from the civil society. But the interventions don't have the broader vision, which is source and destination. If an intervention is happening with the mothers at one place where she is there right now, a lot of them migrate also. Where is the intervention on the source and migration? When I particularly see the policies of last decade, means last 10 years, there are sudden changes which happens in the policies. There's sudden things which gets introduced. It's good also. Things should move on, like we move on in life. So policies also move on in life. And there are very interesting people, on this panel who were talking about food diversity, etc., etc. But I would also like to bring something on table about the culture. What's happening on the culture front? Why carbohydrates are getting more used and less of protein and less of other things? So you go to the villages, they are growing millets, they are growing ragi, they are growing wheat, they are growing jawar, they are growing many other things. But when you see the consumption patterns in many places, especially in the tribal areas I'm talking, so they have maize, they dry the maize, they consume the maize throughout the year. When you ask them what is happening to the millets, why you are not consuming them, they say isme zyada paisa milta hai. So this is for selling. So and many other things. Then I personally think, marketers like us or marketers like others needs to be super responsible. What we are doing with the young generation, what we are doing with the kids, what we are doing with the moms. So some brands of biscuits are reaching to the last mile. Some so-called immunomodulators are reaching to the villages last mile in terms of some food supplements and other things to the moms. When you see the amount of sugar in that, it is so alarming to see, like a country like India, which is the diabetic capital, where we are saying you consume this and you will be fighting against COVID, you will be having better, your body mass index, you will be able to deliver better. So there are so much myths and misconceptions where in the last mile populations, the last quintile populations, where basic food is not getting available, where take home ration from the government is not getting available, there a packet of small biscuit, I will not name it, it's available there. And you see the consumption pattern. Daily, a child eats around 2 to 3. I have seen it myself. And you see moms, so one dabba after another dabba, people are, the marketers are making them hooked to take that. What is happening to the lactation, policy? Are we very strong on lactation? So lactation is an art. So are our frontline health workers trained enough on lactation? It is the counseling. You need particular type of counseling on the latching. How latching is to be done.
Yeah.
Ravi, how are you achieving this all in the project which you are doing?
Yeah, so I'm coming to that, Kamal, now.
Yeah.
So it's very interesting to have various things like, the two mechanisms what we have said. One is the artificial intelligence and second is the blockchain. Blockchain we use to ascertain the results. Are the results fudged or results are true? If someone says I am able to save a child's life who was Sam, means severely malnourished, he has moved from Sam to ma'am to now normal. So what is the journey? So the whole blockchain mechanism actually ascertain the results for us. That's the first part. Second is the AI part. So still like, a lot of work happens on the manuals, on the records, on the reportings. So like you have the image sensing techniques to see, like when you put the sensors on the face, you can actually see like, how much pain your body is going through. There are technologies like that. So we are working on the AI technology to ascertain like which all pockets are the hotspots, like, so that the intervention is designed on the hotspots more and all the level of efforts goes there. It should not be an intervention where you are just doing the Jan Jagruti. I totally understand. It should be a public movement, but the first focus is to basically save the kids who will be dying if you don't intervene. So this AI has helped us, Kamalji, for reducing the referral time. Like today, a child is being diagnosed, like child has SAM. So it takes to reach around, the nutrition rehabilitation center 14 to 15 days to reach. And that period is a very, very big period. From that 14 to 15 days period in the geographies where we are working, we have reduced that time to 2 days. And 2021 for us, it will be, in less than 1 day. We should be able to do the referrals. So we have put up the voucher schemes. We have the vouchers in place. So those vouchers are conditional vouchers and all through, e-money transfers, which takes care of transportation of, kid, which also, because there are certain levels you have to take the kid to certain times. And this whole, our national programs focus on, moms to be there with the kid in the nutrition rehabilitation center. When we talk about family, when we talk about parenting is not just an issue of mom. There is a role of father also. So if a child has to be admitted in the nutrition rehabilitation center for 14 days or 15 days, the parents, it's a joint responsibility. Mother also needs, psychological balance, moral support, financial support, and many other things. So we enable men's participation in the program so that when the kid is admitted in the nutrition rehabilitation centers or getting referral, father has enough money to travel with the kid and the mom. On the top of that, then, there is a very interesting point on the M-Narega. So what is happening, like, when your kid is admitted for 14, 15 days, you tend to be with the kid. So there is a loss of job. You don't have the money. Because I'm purely talking about the last quintile population here. So making sure they have the money when they are getting the treatment done for the 14 days. And after the child comes home, after treatment completion, we see like, we follow up every month rigorously. And there are community nutrition workers who just don't speak Marathi or Hindi. They speak the tribal dialect like Pavadi and Bhil and others, so that there is a less, communication deficit, and we touch the social norms, the values, as well as, the subcultures. And our whole program is designed on the basis of behavioral change communication by identifying the behavioral nudges. Where when we started at Kamalji, a big part of the technology came in place where we had the ethnographers staying in the community for a period of 6 months before we designed the program. And then this technology comes into play. This is my submission.
So much. Thank you so much for highlighting this point. And the most remarkable thing which you are saying, that with the technology you are able to actually escalate the children to the rehabilitation center faster. Now, I would like to actually, I was keeping Dr. Atreja, up at 1 a.m. in the morning. So Dr. Atreja, you have now heard almost every aspect of Indian nutrition saga. And from so many policies to 3 kind of hunger to the burden, and then also somebody highlighting so strongly the role of technology. You are bringing some technologies and you are trying to bring in some kind of intervention for women and child health in the country, in India. And you are seeing it from the New York, and then from the most of the technologies are at your disposal. How do you see a solution for this problem with the role of technology?
Thank you so much. Kamal, first, I want to really thank you for having me here. And then also, I've just really enjoyed. This is probably one of the most productive 1 hour time at 1 a.m. that I've done over the last many years. And really learning a lot, and also allowing me to come back to my roots. I was telling Jagmeet Madan that, I worked with Anup Mishra and learned a lot from him when I was at AIMS. And I learned a lot from public health. And that led me to come to US to do Masters in Public Health and really look at a system-based approach, how we can address problems. And one of the things which I found the gap in public health was, how do you scale the delivery of the programs? There's so many, and Dr. Lakshmi actually just hit it in the nail. They say we have so much science and we have so much well-thought programs, but how do you deliver that was a challenge which I was struggling since 2000. And once I started doing my residency in US, I spent 2 years building and coding and doing data science work from 2002 to 2004. And that led me to see that informatics, IT, and digital health can be the biggest source for empowerment and delivery of programs. And I'll talk about that example, how that addresses this. So for the last 8 years, my focus exclusively has been on digital health as a scalable solution to deliver the science of what is learned in healthcare. And the reason for that is the major gap in healthcare delivery is it is locked with space and time. What I mean by that is, ultimately the care is delivered through frontline health workers, through clinicians, through nutritionists. But they have limited time to talk to each person. Think about each of the clinicians we have in India. How much time they have to impart nutrition, education, or awareness to the people that comes to them. In 5 minutes, they have to give a medicine. They don't even have time to do that. And the second part, which Dr. Khera mentioned so much, is lack of awareness. How much of the knowledge, the pre-diabetic population knowledge, or the programs clinicians have or frontline health workers have, right? So how about we create a program, a digital program, which takes the best knowledge that is there, and at the click of a button, any healthcare worker can give it to the patient, right? And not only give it once, but actually can remind them and follow them, right? And, Ravi Bhatnagar actually mentioned very nicely about, we also need to have a precision-based approach, because we have two different kind of patient population. One is from obesity and others, and the other is from undernutrition, and sometimes it's combined. So we also need a precision-based approach to know who the person is. So just 2 days ago, Amazon came with Amazon Hello wearable device and an app where you can actually get your body mass assessment just through a 3D picture, right? So you can, at a zero cost, without any device, learn the basic metabolic pattern of a person. And what is best is, you can prescribe an app to thousands and millions of people, to nearly all US population for free, right? So that's where you combine digital health as a way to deliver public health program to masses through clinicians and others. And I'm very proud of the initiative we just got started through RX Health Health Arch Network, partnering with Diwakar Clinic, Dr. Hema Diwakar, who is, I think, a 2-day force in delivering care through the Artist program. So we partnered and created a digital health program for COVID and for pregnancy. And with a click of a button, we reached out to 3,000 people, women. Many of them were pregnant, and many of them were women who actually were in the pre-pregnancy or pro-pregnancy stage, and taught them how to be safe during pregnancy, and actually gave a prescription of an app which talks about what to do for nutrition and other health for first. Many of you, and actually create a very indigenous Indian version of that, and empower that, and scale that program through artists and others to millions of patients as well. and then assess the benefit by doing a text-based survey to say, first, has it improved their awareness? And secondly, has that improved their action and behavioral change? Right? One is to empower awareness. If I tell my patient, the other is to actually assess the behavioral change in them, and then have a separate kind of a motivational intervention which can happen through AI. If a person has not made a behavioral change, is it because they have not understood it? Is it not because we're not governed in their language? Or is it because they need a nudge from a nutritionist? They need that specific phone call, right? And you can have an assessment and automate that part and have a chat-based option to motivate them. So we're also talking to CureFit, talking to Goki. How do we actually create a new kind of extenders for healthcare, which could be counselors, which can chat and make democratize that channel, so you don't have to necessarily come to a visit with a clinician. Clinicians can come to you in your home, right? So these are some of the initiatives, but I know Dr. Hema Devakar may be on the call as well. We really want to touch from 3,000 people to 1 million people, pregnant females. And we cannot do it alone. We can only do it together. And so just want to kind of anchor that sentiment in that regard.
Thank you so much, Dr. Assis, for highlighting. And I'm sure with the technology intervention you are talking about, we can reach to a large number of society, population, and at least to the caregivers. I would just like to take because now we are running out of time, so I'm so sorry, but I will not be able to take the comments from all of the people. But just let me since I began with Dr. Ajay Khera. Dr. Khera, you have seen that, and in your experience of public health handling the nutritional deficiency, and now we are talking about blockchain technologies, apps, and then the wearables, and getting 3D, BMIs, and so many things. Do you think that these are going to help when it comes to solving this problem of malnutrition among our children, women, which we are struggling for last 74 years or 73 years now as an independent country? Dr. Khera, you are on mute, sir.
I think what you said is really very critical, and we must make best use of the available technology. Whether, as Dr. Bhatnagar spoke about something in terms of referring the children to the the rehabilitation centers at a very short duration, because he said around 2 weeks are taken. But if you use the power of technology, you can make those referrals easier. And similarly, when Ashish was talking about the role of digital technology, that is also relevant, and particularly for a country like India, where we have a huge population, where there are challenges of access of healthcare, and where it is not possible to provide specialist doctors to the remotest part of the country. I think the way forward is the digital technology, and we must make use of it appropriately.
Thank you so much, Dr. Khera. So with this, I would like to close our inaugural session, and just to sum up that the challenges which we as a country we are facing are immense. The numbers you have been hearing from the entire 1 hour of this session, that we are grappling with a big problem, serious problem, and it is a kind of national emergency to take care of. But there are the new ways of handling it. As Dr. Khera said, we need an out-of-box thinking to address it, and how Dr. Madan and Dr. Lakshmaya highlighted that how with the right kind of understanding and behavioral change and nudges, we are going to make that difference and achieve these ambitious progress when it comes to reducing the number of or the prevalence of malnutrition, undernutrition, anemia, and so on, which is ailing our population, which is wonderfully young. We have the highest number of children in our country, in the world. who are also going to be the young adults, and the going to join the productive population of our nation, and going to fuel and propel this country to become the superpower which we all try to, or dream of reaching to. So with this, I would be ending this session, and I would request my team to play some of the videos of our partners with whom help we were able to put together this 7-day long program. And the next session will be then moderated and hosted by my second panelist. And with that, goodbye for this particular session, and thank you so much all our speakers, Dr. Khera, Dr. Madan, Dr. Lakshmaya, Dr. Atreja, for joining us from US and staying up with us till too late, and also Mr. Ravi Bhatnagar. Thank you so much.
Thank you very much.
Bara, 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 ho bara. 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 बारह से नीचे मुझे चैन ना आवे, दिल धक धक होवे, सांस भूल जावे। बारह से ऊपर हो तो जान में जान आवे, चेहरा खिल जावे, सारा काम हो जावे, फिर सब कुछ लगे प्यारा, जीवन जैसे बहती धारा, सबका मैं बनूं सहारा, क्योंकि मैं हूँ मोर देन बारह। बारह, बारह, बारह हो बारह। बारह, बारह, बारह हो बारह। बारह के नीचे मेरा दिल घबरावे, बाल झड़ जावे, चेहरा पीला पड़ जावे। बारह से ऊपर तो बात बन जावे, शक्ति आ जावे, सांस दुगना हो जावे। मिल गया खुशियों का इशारा, खुद को मैंने फिर संवारा, खुल गया सेहत का पिटारा, क्योंकि मैं हूँ मोर देन बारह। बारह, 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 बारह हो मेरा बारह। बारह, बारह, बारह हो बारह।
Even I am more than 12, which means that the iron content in my blood is more than 12. If it's less than 12, then we are anemic. And being anemic is a hazard for every woman, for her health and for her pregnancy. Let's make India anemia free and take the first step today by taking a blood test. The iron in your blood has to be more than 12.
More than bara.
Processing of food renders most innate micronutrients ineffective. This is due to the harsh conditions such as heat, pH and light that impact the levels of vitamins during the process. Hence, there arises a need to replenish the lost micronutrients back to its source. Micronutrient fortification is an excellent tool to restore the lost nutrients. According to industry experts, it is employed in a lot of countries where the rate of micronutrient deficiency is high. Fortification is a process of enriching food products with vitamins and minerals in order to help people meet their nutritional requirements. Micronutrient premixes are convenient yet powerful solutions to help curb the incidence of deficiency diseases. Premixes are blends that contains the optimum levels of vitamins and minerals that go into the intended food products. Mostly staples such as wheat flour, edible vegetable oil, salt, milk and rice are chosen for fortification, as they not only serve as efficient vehicles for carrying the micronutrients, but also given the fact that the majority of the population consume these products. Various governments have mandated fortification of different staple food in order to tackle deficiencies. Examples of countries: Mozambique, Malawi, Zimbabwe, South Africa, Nigeria, Uzbekistan, the Philippines, Indonesia and Saudi Arabia, to name a few. Even India is considering fortification as a gateway to a healthier future. Hexagon Nutrition is a pioneer in the field of nutrition for the last 25 years. We aim to make the world a healthier place by taking a step towards eradicating global malnutrition. We work with FMCG companies, NGOs and governments across the world to promote healthy living. Hexagon Nutrition has 3 broad product lines. Clinical Nutrition. Hexagon offers a wide range of clinical and wellness nutrition products that are targeted towards different ailments such as renal health, weight management, geriatric health, etc. Therapeutic Nutrition. Our therapeutic range of products helps reduce the degree of severe malnourishment among children. Our products are very dense in energy, protein and fat. Customized micronutrient premixes. We work with multiple NGOs, governments and FMCG companies, offering our micronutrient blends that are employed across an array of food applications, such as rice, flour, beverages, dairy, oils and fats and noodles.
Welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious Vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A, R, T, advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. Artist has also laid emphasis on lending emergency care and medical aid to women during childbirth. Artist has closely worked with the national body FOGSI and international body FIGO. The skill transfer by Artist is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
Welcome to this session on making homes, families, and communities as frontiers for affordable and accessible nutrition. Let me introduce myself. I am Dr. Satish Kumar, and I have great pleasure in welcoming you all. And we will have very enriching session, let's hope so, because the topic itself is very, very relevant and important. So I think in this session, we'll be having 4 or 5 speakers. We will have Dr. Sanjeev Kumar, we'll have Dr. Seema Puri, we'll have Dr. Davina, we'll have Dr. What's there? Dr. Dr. Shalini. Am I missing anybody? Now, let me begin by saying that we are grateful to the organizer, Integrated Health and Wellbeing Council, for organizing this session as part of the celebration under National Nutrition Week, which began 2 days ago. Well, the very purpose of National Nutrition Week, which has been celebrated for, I think, more than many decades now, is really to create and awareness, public awareness and social momentum to improve nutrition status of our population. But somehow, you must have heard and you'll bear me out when I say that the situation on the ground is far from satisfactory. We have the unfortunate distinction of having largest number of malnourished children, mothers. Global Health Index, Hunger Index places us on 104th position. I think now we have moved to 102 position out of 117 countries. And what is most painful to note is that the country's score has only improved by, say, 22-23% over the last 30 years. When we compared this progress, this improvement, with our neighboring countries like Nepal, which has improved this score by 40%, even Pakistan has improved this by, say, about 28%, Brazil by 45%. So really, I mean, this is a cause for concern. This is in spite of the fact that we are producing enough food grains. The cereal production has been quite sufficient. Rice production, wheat production, milk production, we are self-sufficient in that. And it has been a situation for quite some time. There has been improvement in GDP. So the food is there, but this food has to be made accessible in the family to those who need it most. And then there's a paradox. The number of families, households, where both adults and children, they eat sufficient quantity, has again declined from, say, 20%, say, to. And what is more paradoxical to note is that in more than 50% of the families, I think where the child with malnourishment is there, adults are consuming sufficient calories. So something we have to really be very careful about. And it is in this context that the subject of today's discussion assumes critical significance. The frontiers, the family, the household, the community, they have really to make collective effort to change the situation on the ground. I think production is one thing, but then distribution of food, after fortification, intrafamilial distribution, cultural practices, supporting caregivers in the family, all those things are critically important. So I will stop here, and then we'll begin with the introduction of speakers, and then we'll have views expressed by learned panelists. So at the very outset, I think I'd like to sort of invite Dr. Sanjeev Kumar. Now, let me introduce Dr. Sanjeev Kumar. Dr. Sanjeev Kumar is a medical and public health professional with more than 40 years of experience. And he is a postgraduate and medical graduate from All India Institute of Medical Sciences, Delhi. And he served UNICEF for more than 24 years, within the country, outside the country. More than 22 countries he has worked as health and nutritional professional, and thereafter as regional advisor. And then after coming back to India, he served International Institute of Health Management Research as Dean to start with, and then very recently he's also served this institute as a director. He also served Government of India as Executive Director, National Health System Resource Center. And at the moment, he is the chairperson of Academy of Public Health Academy, and he is also advising number of NGOs and other professional groups. I am fortunate to have worked with Dr. Sanjeev Kumar and to have known him for more than 30 years. Now, Dr. Sanjeev, over to you. What are your views on this very important topic, and is here.
Thank you, Dr. Satish Kumar. Before we came live, I was discussing with Dr. Seema Puri and other panelists that we have this false feeling that we are the experts and the community is kind of illiterate and they need something we can deliver. Even in the previous session, some of the speakers said we have problems in delivering what we want to deliver to the people. I think India has become or is becoming a superpower in information technology, in agriculture production, in space technology, because of the people, not because of the government. Yes, government puts in place policies which facilitates the work. So if we are self-sufficient in food grain, despite increase in population threefold, and in 60s, when I was in school, we were not having sufficient food. But today we have. So each one of the farmers is producing that food, not the government. Government is facilitating that. So similarly, when you talk about nutrition, look at each one of the families, each one of the homes as the resource person, not the other way around. So I think we need to have bottoms-up approach. And there are a lot of good things happening in families. If children are malnourished, more than half of them are well nourished. Why? Because the families are taking good care. So look at what is the behavior which makes children well nourished and what are the behaviors which make them undernourished, and change the policy to facilitate, identify the behavior which is good and is already being practiced by a majority of families, and how can we improve on that. We look at broadly three components. One is the food production component, mainly agriculture, which produces food grains, cereals, oil seeds, fruits and vegetables. These are essential for improving nutrition for all of us. Then you have industry, sugar, oil, salt. Then you have agro industry, which picks up the food grain and converts it into industrial products which are related to nutrition. Then you have animal husbandry. You have milk products, you have ghee, you have eggs, meat, etc., which comes from animal husbandry. So these are three primary sectors which produce food, and the food is then goes through the supply chain and it comes to the final frontier, which is home. You take food at home, you cook food at home. So that's very important. So every one of these two other components and the policy environment must support the families. And what happens at the family? They decide what to buy. They decide what to cook. They decide how to cook it and how to handle the food at home. They decide what to give to the vulnerable, pregnant women, lactating women, children, elderly, those with non-communicable diseases, etc. They decide how much to give to whom. They decide how often, in what quantity. All that happens at home. So let's keep that in mind. And that's why I say, if you want to fight malnutrition, improve the nutrition of the country, the final frontier is home and the family. So there are three major factors. I will go into a little detail of the third factor. First one is access. The food has to reach them. And there are also instances when a farmer produces healthy food, but he or she sells it in the market and buys something which is not as nutritious. So those who produce food not necessarily take that nutrition food where they should be taking. So one is the access. Second is affordability. Why do they sell the food they produce? Even if it is because they get more money and they buy food where they spend less money. It may be less nutritional. So they move to cash crops, etc. So even farmers, a large population of India is into farming. Even their children, their families are malnourished because they are not using the food they are producing for the rest of the country. The third practice, I will go into that a little more detail. how the food is handled and cooked at home. You have food habits which have very strong roots in socio-cultural practices, local tradition, local customs, local beliefs. You have religious beliefs. Some people will not eat beef and some people will not eat pork. So these are the religious beliefs which handle. I will go into little detail of traditional practices. In India, because of Ayurveda, which has been here for thousands and thousands of years and has very good practices which are in place. The so-called modern qualified people don't believe in those practices. Give you an example. Many foods are considered to have garam tasir, hot tasir, hot after effect. What are these? Meat, fish, eggs, jaggery, sugar, almonds, groundnut, coconut, fried foods, mango, jawar, bajra. Jawar, bajra, very nutritious cereals. Then you have foods with cold tasir. You have curd, buttermilk, rabdi, green leafy vegetables, green gram, lemon, salt, etc. Then certain foods are considered heavy. Black gram, the pulses in general, beans, halwa, buffalo milk, ghee. Then some foods are considered light, and all of us have grown in our childhood. When we were sick, we were given these foods which are considered light. Khichdi, dalia, rice, curd, saag, bread, biscuits, cow milk. I remember when I was growing up as a child in a small town, if somebody went out to buy bread, the first question was, oh, is somebody sick in your family? So, some of these foods have been traditionally used. And how does it affect practices? I was at a primary health center, Dr. Satish, and we qualified from AIMS, big doctors with bloated heads and bloated egos. The villagers were advised, pregnant women, this was predominantly a vegetarian village called Dayalpur, our PHC headquarter village. We will tell women, take legumes, दालें खाया करो. And they would say, नहीं डॉक्टर साहब दाल तो गर्म होती है, बच्चा गिर जाएगा. And we said, what nonsense. I am telling you, I am the doctor, please go and take dal more often. And also they used to have good papaya produce in that village. They will say, give them more vitamin A rich food, you grow papaya. And they will again say, no sir, papaya is hot and abortion will take place. And we will rebuke them, laugh at them, send them back home. What was the result? They didn't even take iron folic acid tablets we were advising them to take. All our advices were ignored. This doctor is a fool, doesn't even know. I am illiterate, I know that these foods are warm. So I went back, studied, bought Charak Samhita, studied the Charak Samhita and came back. And after reading that, I talked to them, put little salt in the dal. Oh yes डॉक्टर साहब, हाँ दाल के नमक के बिना तो हम खाते ही नहीं है, और जो नमक की तासीर है वो तो ठंडी होती है और दाल की तासीर गर्म होती है, वो तो बहुत बढ़िया. And they started not only consuming दालें, they also started consuming iron folate and listening to our advice. We need to respect what their traditional beliefs are, not just laugh at them and ridicule them. Otherwise, you will not be accepted as a professional. They will not listen to any other advice as well, and you will not be able to provide services. You also have some traditional practices, Anna Prashan Sanskar, all of you have heard, and it is common across the whole country. At 6 months, the baby is introduced to semi-solids, kheer. Rice and milk preparation is the commonest food given to the baby when you have Anna Prashan Sanskar. You also have small babies massaged in sun for vitamin D. Now we are saying, oh, we don't get exposed to sun, and most of us are suffering from vitamin D deficiency. So that traditional practice of massaging the baby with oil, taking all clothes off is good for, so there are many good traditional practices. We should build on them and go, yes, that's a great thing you are doing, but can you do this as well? Then you start addressing undesirable practices. Then food preparation, sprouting, fermenting, and issues related to how do you cut and wash the vegetables. Tell them not to wash it after cutting, because then water soluble vitamins will also get washed away. Cooking, at what temperature? Some of the food items, micronutrients like vitamin C and one of the B complex vitamins, thiamine, get destroyed. Boiling milk is good, kills the bacteria. That's a traditional practice in India. They boil milk and it makes it more digestible, and it also kills bacteria. So, home is the right place. We have been advocating right from the inaugural session on day one that we need life course approach to nutrition. It starts in utero and needs to continue when they become elderly and are ready to leave the world. So that approach can only be practiced at home, because you have a pregnant woman and you also have people who are elderly. Family, home is the largest training institute in the world. All the adolescents, all the children pick up desirable food practices and food preferences at home. So that should be the university, and let's treat that as university for educating children and adolescents for picking up the desirable practices. And when a baby is 6 to 9 months old, the taste buds are developing that time, and that is the time the baby needs to be given the desirable foods which you want to give. Don't give high salt, don't give high sugar, because then the baby will get used to high sugar and high salt food, which will be predisposing baby to many diseases in the adult. So by focusing on the family and community and home, you will be able to improve the nutrition status. The sectors, the government only has to put in place desired policies. Don't be under the false belief that we will deliver and they will take it. That is a wrong, bureaucratic, colonial approach to addressing nutrition problem. It will not work. I am very happy. Yesterday, the government announced they are going to convert the bureaucrats into karma yogis, so that they don't continue to work in silos. They don't talk to each other. They belong to the same cadre, but one ministry doesn't talk to the other. They want to work on their own. So this effort hopefully will bring different sectors together, because everything you do in whatever sector, public or private or ministries, gets together at the family level. So why not at the planning level itself, you start looking at comprehensive integrated approach and break down the silos in which we are used to working. Another initiative the Prime Minister announced in the Mann Ki Baat last Sunday, nutrition monitors at community level, nutrition card, that will also improve nutrition at family, at home, and institutions at community level. With that, thank you, Dr. Satish.
Thank you so much. Thank you so much, Dr. Sanjeev. I mean, you have brought to surface many important, dimensions, and particularly, I'm quite impressed by your, pointing out the fact that within the same family you have children who are not malnourished, in spite of the fact that there are children in the same family who are terribly malnourished. So this whole approach called positive deviance has really led us to solve say serious problems at the community level of child malnutrition, and we'll discuss more about that. And I think the family really is the most critical say place where child nutrition can be promoted. Not only that, family is also a place, as you very rightly pointed out, where intrafamilial, food distribution and inequities can be handled. So we'll have further discussion on these very important points raised by you, and the role of community and the role of the household itself with regard to the sanitation practices, because we have to also prevent the nutrient loss within the family. The whole issue of social determinants affecting at the family level. If time permits, we'll have discussion. Now we move on to our next panelist, who is Dr. Seema Puri. Now, let me introduce Dr. Seema Puri. I have great pleasure in introducing Dr. Puri. She is currently Executive Council member of Nutrition Society of India and also a member of the Indian Academy of Geriatrics and International Federation of for Home Economics. She's also a member of FSSAI, the Food Safety Standards Authority of Government of India, especially on the scientific panel on labeling, claims, advertisement, and also on dietary production and nutraceuticals. So it's a very important position she's holding in advisory capacity. And she has over 30 years of teaching and research experience with a specialized training in nutrition epidemiology, qualitative research methodology, global health research, and social gerontology. She has undertaken consultancy, research, and advisory assignments with UNICEF, WHO, University of Sydney, Department of Science, Technology, and ICMR, and she has over 50 publications in peer-reviewed journal, and she's also an author of a very popular textbook on nutrition and dietetics. Over to you, Dr. Seema. Let's build on what Dr. Sanjeev Kumar has said, and there are how can really we have family, community, and households empowered to deal with this problem of child malnutrition, maternal malnutrition, which has been in the country for quite some time, which is pervasive and persistent. So let's hear your point of view on how to really solve this problem. Dr. Seema, the floor is yours. Dr. Seema, yeah.
Very crucial. Thank you, Dr. Satish Kumar, for a very gracious introduction, and IHW for inviting me here today. I think Dr. Sanjeev Kumar has set the pace for today's discussion, and I'll just take on from there. When I think of this topic, I think of three words: affordable, accessible, and available. So that available component is very, very important also. And for this, besides what all Dr. Sanjeev Kumar said about culture, tradition, looking at the perspectives of the people, a very strong thing that I feel about is that go local, promote traditional. These are very important. We have forgotten our traditional foods, and we are more into status conscious, we've forgotten things like palsa or shetut or lokat or the certain indigenous varieties of pulses and cereals which are consumed all over India. And we are busy promoting apples from the US or kiwi from Thailand, etc., etc. So I think it's time to go local, to look at foods which are available, which are grown in that area, and they are very rich in nutrient content. The other important thing is that the foods which are locally available will definitely be cheaper, more nutritious, and more accessible and affordable for these people. Again, promoting the use of all parts of the plant. If you look at traditional culture, they would use the root, they would use the leaves, they would use the seeds for the same plant. And all these different parts of the plant, like say if you even take a radish, they would use the radish leaves in a paratha, they would use the radish as salad. So using the complete plant would also give a lot of additional benefits to the communities or the individuals. The thing that I would like to emphasize here, that we have to keep pace with changing times. And today's generation is not really into accepting traditional foods so easily. And therefore, we may need to contemporize them. So when I'm saying contemporize them, it's like, look at the story of turmeric latte. Everybody goes to Starbucks and pays 300 rupees for a glass of turmeric latte. And who hasn't had haldiwala doodh at home, ever? So it's just about the jargon, about modernizing things so that it appeals to the younger generation. When the lockdown started, we had a lot of Dalgona coffee. Dalgona coffee was just nothing but the traditional piti hui coffee, which used to be whipped at home by our mothers and given to everybody, guests, when they arrived. So these are, things which we need to do. We have momos. I was surprised to see momos, which are traditionally a northeastern dish, are being sold in Jhajjar, at every corner, at every crossroad. Can we make them more nutritious? Maybe add a little more greens in them. You get momos, you get tandoori momos, peri-peri momos, pan-fried momos, you name it, and you have 20 varieties of momos. Could we do that to our traditional recipes? Tweak them a little bit, make them more acceptable to the younger generation, make them more with it, I say, so that they are readily consumed. The other thing is the accessibility. I am always surprised that you go to a place like Rohtang Pass. I went to Rohtang Pass, it was snowing, but there was a stall selling instant noodles. Nothing else, biscuits and instant noodles. If the industry can get the noodles up to that height and such a remote corner, can we ensure that nutritious food also reaches there? It could be a public-private partnership approach. It could be requesting the industries to pitch in as part of their CSR initiatives to use their networks to also get healthy food across. So that's the accessibility which I feel is very important. We were supervising a school and the principal was very proactive. He just closed down the school canteen and asked Mother Dairy to open a stall there. And children automatically shifted from Coke to flavored milk, because that was accessible to them, it was available to them. So these are small approaches which could be adopted to make the food, healthy food, more accessible and available to the consumers. Another example, I'm giving you examples from the field because working in this area, it's very interesting to see these examples and learn from them. An NGO in Ludhiana, in Punjab, I saw it in Ludhiana, they have opened Hearts. So every farmer can get his produce there and they have a minimum price written on the board. So suppose I've grown spinach, I can get the spinach there and sell that, and that money is deposited in my account and I can get instead tomatoes or wheat or rice or potatoes, whatever is being sold there. So the farmers are not stuck with perishables, because the biggest problem in the farming thing is the farmer says, why should I grow palak? I don't know where to sell it. Sar jayegi. Tomatoes rotten ho jayenge. So they have a place where they can give their excess produce and get something else in exchange. There's no money paid, but it's only a barter system. They also had women who had volunteered to sit there and cut saag or, peel peas. So they were giving points for the labor that they were putting in, which they could buy healthy food instead. So I thought that was a very nice approach, which could also be adopted at other parts of the country. And then, of course, we have the traditional talk. We talk about community gardens, nutri gardens, school gardens, which are coming up. Even in a place like Delhi, I've been to certain schools where the principal has taken the initiative to start the gardens. And the children grow these foods, and then these children are given some of those produce when it comes out. So those are some of the promotive aspects. When I talk of the things that we need to discourage to promote healthy food, I think one thing is what we call HFSS foods. The high-fat, sugar, salt foods need to be discouraged. And that, of course, the school plays a very important role. There should be community monitors. There has been talk of policies like increasing tax on the soda tax in some countries or on the junk food. And also the food labeling. So labeling becomes very crucial in trying to communicate the message of healthy food and what one should eat and what one should not eat. And of course, India is working towards nutrition profiling, front of pack nutrition profiling, where pictorially it will be depicted whether the food is healthy or not. So I think that's a very good step that we are taking. And I'd just like to end by saying that we need to discourage an obesogenic environment. Today we are living in a world where it's hard to work but easy to eat. It's hard to move but easy to eat. And that is something we need to discourage. So opportunities for physical activity. In fact, the lockdown, if you see, has given an opportunity. Bicycle sales have shot up. Everybody is cycling because the roads are free. There is place to move around. So physical activity, enhancement, and opportunities to eat wrong should be decreased. So that's just my take on how to improve the community, family, and home as frontiers for affordable, accessible, and available nutrition. Thank you, sir.
Very, very thought-provoking discourse. And I really like to stand on modernizing the traditional foods.
Yes.
And also extending the outreach of availability of nutritious food by entering into some kind of collaboration with the private sector. I mean, they can do the job. That's really very, very important. And you very well ended your talk by saying that we have to change the lifestyle. Now, people should do physical activity in order to earn their lunch or their dinner.
Yes.
So that's really very, 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 very important. And I must say that it has to be a very, very concerted, collective effort at the home front, with the family, and with the community to really deal with this problem of malnutrition. Thank you so much for that. And we now move on to our next speaker. And who is, I will request Dr. Shalini. Dr. Shalini Somasundaram, who is with us. She is Chief Dietitian and Head of the Department at Columbia Asia Hospital in Pune. She's also worked in Pune as Senior Dietitian in Aditya Birla Memorial Hospital. And Dr. Shalini has also worked in Chennai as a dietitian in ACER Hospital and also as the chief dietitian at Talwalkar's Better Value Fitness Centers and is a research dietitian in lifelong wellness and solutions there. He also has professional experience of working in Mumbai, in Anjali Mukherjee Total Health Centers as a nutritionist. So she has experience of working as a nutritionist, as a research dietitian, as a clinical dietitian. So let us hear from Dr. Shalini what has been her perspective of looking at nutrition problem as a clinical dietitian and as a research dietitian. Because most of the time we in public health nutrition, we look at nutrition profiles and the impact of government intervention program on most vulnerable segment of population, like pregnant mother, like under 5 children, infants, like adolescents. But we really don't know what is the nutrition profile of those people who are recovering in the hospitals, or what is the aftermath of diseases like cancers, diabetes, hypertension. What is the nutritional status there? So what is your perspective, Dr. Shalini, on improving the nutrition status when you are saddled with the responsibility of handling nutrition status of those who are admitted in the hospital or those who come to you with a specific nutrition problem? Over to you, Shalini.
Definitely. Good afternoon, everyone. Thank you for your warm welcome. And actually, I'm very happy to thank you for this opportunity. As you have been asked regarding in the hospital setup, how we have been working with the patients, like whenever they've been coming to the hospital just for a checkup, they used to come, and once we have been saying the patient condition has been getting thoda deteriorate ho raha hai, that time if the doctor has been advised for the admission and all, so that time it's been very difficult to convince the patient, because they will be having a mindset and they used to have a habitual things of having their own pattern of dietary intake. And whenever we have been meeting a patient for the first time, we used to ask for the dietary recall, what the foodstuffs they have been having, what is their own habits. With that we'll be proceeding the things. But once we have been according to the dietary habits and according to the present biochemical parameters and the present condition, we used to suggest them the dietary modifications and the dietary changes in their current pattern. But for some patients, it has been very difficult to start with the dietary changes all of a sudden. But even though we have been making small modifications in the diet, according to them, it will be like a big thing to change all of a sudden. So that's the difficulties we have been facing. And moreover, regarding with the topic what we have been discussing, as it's been related to the hospital also, I'm saying mainly the diet or nutrition has been playing a major role, and it has been mainly with the family. Like, however, we have been convincing the family, so that will be depicting the result. And what are the dietary modifications we have been giving to the patients, it will be implemented only with the help of a family people. So whenever we have been doing a counseling also, we used to concentrate on the family members. Mostly if the male patient has been there, we used to convince the wife and the mother. As such, like, they are the concerned person, they will be making all the food, matlab kuch bhi preparation hai, and what are the dietary modification they have to do it has been regarding in their own hand. So we used to counsel them only, and mainly in the family, like how we used to consider, like from infants till old age, the main role has been, it has been in the family only, starting from the infant stage, in the pregnant women, lactating women, and in the children like toddlers, school going children, and adulthood, in the old age. Everyone is been having their own requirement according to the age, according to their activity, and according to their height and weight. But nowadays, you can see, matlab, how much ever we have been saying about a malnutrition, and we have been seeing the opposite version of obesity and overweight in the children's also, and mostly in the children's only. And childhood obesity has been major role, like it has been end up in other comorbidities in their future. And we have so many cases of type 1 diabetes, and also some other type of cancers in children's. So nowadays, because of the dietary modifications and because of the food habits, how it is being changed. Likewise, ma'am, Seema ma'am and Dr. Sanjeev sir has been told us, like traditional food beliefs, everything is being changed day by day. And more of the dietary pattern has been like they've been indulging in eating all the fast foods, and mostly, like sir has been told, bread has been like, it is a traditional food. Abhi to it's been like a day-to-day food ho gaya. Everyone, if you've been, I'm thinking about a recall, most of the people used to tell, at least in a day, they used to have some sort of sandwiches has been there. So because of these sort of processing foods in their diet, so they will be end up in obesity, and obviously they will be end up in other comorbidities according to their age factor. So what are the things I believe, what I was being in my practice, even in the OPD, even in the IPD, I used to tell not only the patient, I used to tell the patient relative, this is the thing which he's been going to follow hereafter, that will be not depicting his own health improvement. It will also improve the health of the other people in the family, because which are the dietary modifications we have been giving, it has been not only with their current status, it will improve their nutritional status and well-being. Because what are the dietary modification we used to give, it has been not like exactly you have to change what are the foods, abhi tak aapne kya kya khaya hai, you have to completely change your thing. It won't be work out at any situation, because what are the things we have been read in books, we can't implement all of the thing in the practical setup, because that's what we used to ask the recall, what is the food habits what you have been following. With that only we can able to make a changes in our pattern. Because what are the things we have been read, and we have been simply writing a diet charts and we have been giving them, we don't work out. We have to ask them their own personal likes, dislikes, and their recall, then only we'll make a changes in that. So it has been easy for them to follow. So with that, and once we have been made a diet chart also, we have to ask the patients, is they have been following in a right way, and what are the difficulties they have been facing it up. Is it with the food preparation they have been making it's been finding a difficulty, or with the other things, मतलब कुछ नया foods हमने introduce किया है, for that they have been facing a difficulties. So with that data, and whenever we have been having a follow-ups, that time we can able to know whether they have been following a data or not. And mainly nowadays, everyone used to have a thought, dietitian has been only for a weight loss. It has been not a thing. And once we have been stepping into the hospital, main thing we can able to focus most of the therapeutic diets which we have been giving. Mainly, once the people has been setting up into the hospital, then only they can able to know what are the things they have been having once the test is being done. But until the test is being not done, it has been not like that we have been healed and healthy. So once ourselves we have been testing has been done, then only we can able to know what are the parameters has been abnormal. So it has been not thing everyone has to go to one part for the test. but the basic test has to be done in the family. So everyone, like previously, diabetes or blood pressure or koi bhi heart issues, cardiac ka kuch bhi cases, it will be like more than 50 or 60. Nowadays, we can see it in the early stages also. Likewise, in the children's also, we have been having so many cases, and in the adulthood also, we have been seeing so many cases. It has been better to have a proper health checkups in the equal intervals with the family that will be depicting the healthcare, and that will improve the status, nutritional status of the family also. With that data, we can able to guide them in a right way. And moreover, likewise, I've been told, nowadays also it has been going on practice. The women in the family, they've been having they've been not concentrating on their own health. They used to take care of the father, they used to take care of the husband, they used to take care of a son, and not on themselves. Mainly, aaj ki situation mein bhi so many people have been having the leftover foods. It has been not at all advisable. Mainly, Sanjeev sir has been talked about the type of cooking, how much the temperature should be there, what is the hard foods, what are the cold foods. But apart from that, the foods which has been stored, it has been not a frozen foods we have been getting, but which the foods has been prepared in a right time and right temperature. Even it has been stored in the refrigerator and they have been using it on the next day, and it has been not at all advisable. But even though nowadays, even in this century also, the female who has been in the family, they've been taking care of throughout the family, but not on themselves. That is a main thing. Mainly, the women one stage, they have to, as like sir has been told, like within a 6 months, they have to start with the weaning food. But in my hospital setup also, I can notice so many people, they've been like, they're literate, but even though they doesn't have a knowledge on, either they have to start it at early weaning, 6 months if they have to start karna hai, or they have to wait till 1 year. They have been having a doubt. So I'm having so many patients over here till 8 months, the baby has been under only breastfed. Apart from that, they've been not started any food at all.
That's right.
This is a one thing. So that is mainly a difficult thing. So that time, achanak se humne shuru kiya to bhi, so we have to concentrate on so many things. Either the milk is being suited for the baby, because they've been not started the outside milk also, and the egg is being suited for the baby. Either each and everything we have to counsel for the patient. Mainly we used to train them which each and everything, like how many scoops they have to start it up, in which way they have to start it up. As like sir has been told, mainly salt and sugar will be restricted till 1 year of age. That has been like a good point we have to remember. And we used to advise for the family, it has been starting from the weaning foods until in the school going age also. We have to concentrate on more things, because abhi aaj ki situation mein they've been forgotten about the vegetables at all. Nobody has been having in a form of any sabji at all. Mostly the children's prone to have more aloo or other vegetables. Mostly like a green leafy vegetables has been eradicated in their diet.
Absolutely
So,
right. Yeah, you are absolutely right. As a matter of fact, you're very rightly pointing out that in order to ensure continuity of care, the hospital advice has to be really linked to the family setting, and you have to ensure that whatever you are saying in the hospital, what you are prescribing in the hospital, is also complied with. Otherwise, what is said in the hospital, if not complied at the family level, it goes, it has no impact. So I mean, since we are racing against time, so yeah.
Follow up also.
Follow up, yeah. So I mean, I think these are very important points which you have brought to surface. The follow up care at the family level. As a matter of fact, in our standard,
family, it is not only particular patient. It should be along with the family. So the family member will also have a knowledge on it, and they will be applied to the other friends also. So
exactly.
the society also will gaining a knowledge regarding that.
I also, get enlightened from what you are saying. The role that the hospitals or tertiary center can play to strengthen the practice of primary healthcare at the family level. So that's very important. This is a take-home point from your talk, that nutrition is included as an integral component of primary healthcare, which we think is going to be practiced at the primary center or at the family level. But then it has to be strengthened by those who are credible source of information working at the tertiary care level. So that's very important. And I think since we are racing against time, I will take this opportunity to move on to our next speaker, who is Dr. Babina Nandakumar. And I have a great pleasure in introducing this speaker to our rest of the panelists. Now, she is a qualified, professional in the area of yogic sciences and naturopathy. She is BNYS, Bachelor in Naturopathy and Yogic Sciences, and she is Chief Medical Officer at Jindal Natural Care Center at Bangalore, and where she is leading a team of around 35 naturopathic physicians. She is also an active research worker and has been a speaker at various national and international conferences, and has authored, close to 4 books, and has published many research articles on the subject. Now, especially Dr. Babina, we are all very keen to know that in this current situation, when we are hit by the pandemic of COVID-19, which doesn't have any prescribed cure, most of the people are talking about, building immunity, changing lifestyle, adopting positive attitudes, having foods which boost your immunity, and more and more emphasis on modifying lifestyles and building innate immunity. Against that background, how really you advise the fellow professionals and people at large to build their nutrition status? Over to you, Babina.
Okay. Thank you, Dr. Satish, for your introduction. And also I thank the organizers for inviting me here for this panel discussion. So I think now everybody have spoken enough about the nutrition and the traditional ways and all that. So as you have told that I'll be speaking about the immune system. See, as you all know that immune system is the army of our body. It is not only during this pandemic times, even otherwise also, boosting up our immune system should be an important part of anybody's life. That is very, very important. See, you can have a flu outbreak any time of the year. It may not be only COVID-19. It can be any type of infection or any type of infectious diseases like maybe dengue or chikungunya, whatever type of disease. So it will not affect each and every individual, though you're living in the same neighborhood. It can attack a few and it can not attack other few families. This is because it depends upon how strong your army is or your immune system is. We have 2 types of immune system, that is the innate immunity. In naturopathy, we emphasize more on the innate immunity. That is, your body has got the capacity to heal itself when it is unhealthy. But only thing is that you need to provide proper treatment and have patience and time and give proper rest to your system. That is very important. See, in naturopathy, we believe that accumulation of toxins is the root cause for all diseases. How do you get toxins? You might say that I eat a healthy food, I eat only fruits and vegetables, and I eat all superfoods like other panelists were mentioning, it's only kiwis, strawberries, blackberries, blueberries, whatever it is. But still I fall sick. Why is that? So building up your immune system with the good food is very important, especially foods like vitamin C. So vitamin C food, you don't have to go for fancy foods to acquire that. You can get it simple with the sweet lime, that is the Mossambi. You have good amount of vitamin C. You have got lemon, which has got good amount of vitamin C. And even gooseberries, amla, this is a good source of vitamin C. Oranges, all these things you can consume in abundance, which will give you sufficient amount of vitamin C. Apart from vitamin C, zinc is also very important to boost up your immune system. So the foods which are rich in zinc, like pumpkin seeds, sunflower seeds, and then almonds, walnuts, these are all good sources of zinc. And vitamin D, which is a free vitamin which is available for everybody, whether rich, poor, undernutrition, overnutrition, whatever it is, you have to expose to the sunlight every day. That is very, very important. because vitamin D is a immunomodulator and it is an immune booster. Even for all the other vitamins to get absorbed properly in your body, vitamin D is very, very important. So exposing yourself to the sunlight every day in the morning for half an hour and then again in the evening for half an hour will definitely help you in boosting your immune system.
That's true.
Apart from this, you should have salads. Raw salads are very good because what happens is most of the vitamins and minerals like vitamin B complex and vitamin C, they are not heat stable. So once you boil them or heat them, they could get completely destroyed. But whereas when you take it in the raw form, you get all the vitamins, minerals intact. It's like taking a multivitamin pill. So instead of going for a multivitamin pill, which is a synthetic and it has got a lot of side effects also in that in the long run, it is always advised you go for a rainbow salad. That is a salads and fruits and sprouts which contains all 7 colors. You have colored vegetables, red, yellow, green, all the purple, violet, everything you have all colored vegetables. So try to incorporate this rainbow salad in your diet every day to boost up your immune system, which is very, very important. And apart from that, eating sprouts made out of moong, moat, alpha is very good because it is a very good source of vitamin B complex and vitamin C. So sprouting enhances the absorption of these vitamins, minerals and amino acids which is present in these grains properly in your system when you sprout it up, and the digestion also becomes easier. Because for some patients who have a weak digestion and a lot of flatulence, belching, burping and all those people, they will be benefited when they have this sprouted steamed sprouts. And apart from that, you should be eating more of nutritious food that have low energy density. That is, example of low energy density food is that which is fruits, lean, then wholesome grains, beans, cabbage, cauliflower. These type of vegetables are very good. And you should avoid saturated fat. That is the butter, cheese, fried food, sweets, chocolates. All these things has to be avoided completely. And even alcohol and smoking also has to be avoided, because alcohol smoking also inhibits in the absorption of nutrients in your body, and that also weakens your immune system in the long run.
That's important.
Yeah. So that is the reason to improve your immune system, the main thing what you have to do is you have to detox your system. That is very important, I'm telling you. The diet part is one part, but the main part is that detoxification of your internal system is very important. See, in naturopathy, what we believe is that we have got the 4 natural outlets in our body. That is the skin, kidneys, lungs and intestine. That is the large intestine. So when you undergo this naturopathy treatment, we try to stimulate the skin with different types of massages. That is the manipulative therapies we have. We have the Swedish massage, we have the deep tissue massage, the hot stone massage, chirally massage, lymphatic massage. Different types of massages are there which helps to improve your blood circulation, your lymphatic drainage, and the research has proved that it improves the natural T killer cells. That is the main immune booster cells in your body. And then we have the kidney pack to detox your kidneys. We have different types of packs like the kidney pack and the different types of hydrotherapy treatments like the hip bath, and even the natural diuretics. I can tell you, you can drink tender coconut water, barley water, jeera water, dhania water, tender coconut water. These things are very good to dilute the toxins and then excrete it out of the kidneys. And then for the skin, we have the steam bath, sauna bath, the sun bath. These things open up the skin pores because skin is the biggest excretory organ in our body. So once we give all these type of heat therapies, the skin pores are opened up and all the toxins are excreted out of the skin. And then for the lungs, we have the yoga and pranayama, which is very important. So we have different types of therapies also to remove the excess of mucus and phlegm from the system. And that is, we have the drainage drainage therapy we have, and we have the partial massage to the chest and back, and yogic kriyas like Jalneti, Sutraneti, Vaman Dauti, Vastra Dauti, all these things helps in removing the excess of phlegm from the system. And apart from that, pranayams like the Anulom Vilom, Bastrika, and then Kapalbhati, all these things helps you to remove the toxins and the phlegm from your system. So to build up the immune system, apart from the detoxification, diet, yoga and meditation is also very important, because yoga is the only thing which can bind your mind and body together. And meditation is also very important to improve your sleep. That is also very important, because sleep is also very important, because what is happening in this pandemic times is that because of the loss of jobs, stress, tension, people are having lack of sleep, and people go to sleep also very late. So the circadian rhythm of the whole system is imbalanced.
That's very important.
So that imbalance of the circadian rhythm itself weakens your immune system.
We need to restore that, and I think very, very valuable advice on how really to build up your innate immunity by modifying your diet pattern and also taking recourse to appropriate detoxification measures, which Dr. Bibina has very rightly pointed out. Now, I think we are running out of time. So before I wind up, Mary, I would just like to know from my panelists if they would like to say something which they feel is very vital and like to enrich the session by making some suggestions. Dr. Sanjeev, Dr. Seema, I'd like to say something on what, like to sort of give your comments before I close it. Yes, Sanjeev, you are mute. Please unmute yourself.
Thanks for pointing out. The only message I want to give as concluding remark is we need to reverse the pyramid, put the family, home, and community on top. Look at what they are doing and what we should be doing in policy and sectoral approaches to support them.
That's right. I think what I feel is, after listening to a learned panelist, that this problem of nutrition is both serious as well as embarrassing. It's serious because of obvious reasons, because it leads to very, very serious consequences in terms of cognitive deterioration, physical growth deterioration, loss of productivity, increase in morbidity, mortality, so on and so forth. But then it is embarrassing. After listening to you all, I can safely say that time-tested and workable solutions have been with us. They have been available with us, and we have access to all those knowledge. Of course, knowledge is ever growing. But I think the critical interventions which could have saved the present situation from occurrence were there with us, and we did not apply that. Whether you talk of, exclusive breastfeeding, or if you talk of timely complementary feeding, or using, homemade, say, food items, mixing them in proper proportions, or our traditional practice of supporting somebody in the family to act as a caregiver, to take care of the child, to take care of the pregnant and lactating mother. I mean, those were the systems were there already. Or to have, some kind of situation created in the family to provide psychosocial stimulus to the young child. Because that is very important, early child care. And we know in our families, the grandparents, they used to talk to the child. And studies have shown that if you provide, stimulus to the child, social stimulus is as important as providing food to the child. So I think all these solutions were there with us. Food fortification. Now, India started way back in 1953 to fortify vanaspati with vitamin A and other fat-soluble vitamins. We had, success stories in terms of high digestion of salt, and now we have come up with the double fortification, fortified salt. So these solutions were known, but somehow we could not implement. So that means there is something which we are missing. And what is that which we are missing has to be really found out. We have to build on what people know. We have to really convert this, public awareness, public movement into some kind of social movement for nutrition. And in this context, I think our local self-government, Panchayati Raj institution, our community leaders will have to play a very, very important role to really ensure that nobody in the area, in their elected constituency, is suffering from malnutrition or night blindness, so on and so forth. So community has to come together, the family members have to come together, and really we have to put pressure on our policymakers to implement what are the different entitlement programs. The school has to play a very important role, as most of the speakers have said. So I think if you all make collective efforts, we are really going to solve this problem, which we are committed to address. I will also like to remind you of our 43rd article. 43 Constitution article says that it should be one of the primary duties of the state to improve the nutrition status, to improve the public health condition of our citizens. But so far we have not been able to achieve that. So it only requires collective effort, a change in focus on how we approach the nutrition problem. Nutrition has to be addressed as an issue of basic human right. Then and then alone we are going to solve this. I'll stop here, and I really thank all of you for making very, very valuable and professional contribution to this very important topic. Thank you all.
Thank you, sir.
The world moves on buttons. Ready-to-use green tea fast-dissolving films eliminate food-grade plastics altogether. Refresh, recharge, and rejuvenate with the world's only ready-to-use green tea films today. For more info, visit www.shilpaotc.com.
bara bara ho bara 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 से नीचे मुझे चैन ना आवे दिल धक धक होवे सांस फूल जावे 12 से ऊपर हो तो जान में जान आवे चेहरा खिल जावे सारा काम हो जावे फिर सब कुछ लगे प्यारा जूं जैसे बहती धारा सबका मैं बनूं सहारा क्योंकि मैं हूँ more than 12 12 12 12 हो 12 12 12 12 हो 12 12 के नीचे मेरा दिल घबरा फिर सवारा खुल गया सेहत का पिटारा क्योंकि मैं हूँ मोर देन बारा 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 हो मेरा बारा 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 हो बारा.
Even I am more than 12, which means that the iron content in my blood is more than 12. If it's less than 12, then we are anemic. And being anemic is a hazard for every woman, for her health and for her pregnancy. Let's make India anemia free and take the first step today by taking a blood test. The iron in your blood has to be more than 12.
Welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious Vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A, R, T, advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. Artist has also laid emphasis on lending emergency care and medical aid to women during childbirth. Artist has closely worked with the national body FOGSI and international body FIGO. The skill transfer by Artist is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
Hi, welcome to all of you to the third day of Bharat Nutrition Week. I'm Nikki Gupta, CEO of Teamwork, a specialized media advocacy firm for health and well-being. We are extremely glad and honored to support IHW Council in its endeavor to increase awareness and food in its health, in its impact on health. It's an exclusive talk show on good food, the most important element for having good health and happy life. As a parent, we feel scared about our children catching a cold or getting a fever. Is it a worrying moment for every parent? And we are all try to avoid such situation as much as we can, especially in these times when we are amid of a pandemic. Keeping children healthy, strong, have become more important than ever before. So how can we safeguard our children from falling ill? The most important way to strengthen the immunity in your children. To discuss the same, we have 3 vivacious authors, mothers and influencers with us who will give us more insight how they are managing their child's immunity and what are suggestions they have. To begin with, I would quickly introduce our today's panel. We have Kavita Devgan. She's an eminent writer, nutritionist, weight management consultant who propagates practical, effective, and delicious way to achieve a healthy lifestyle. She's also a very popular journalist health columnist, and has been writing regularly for many media houses like India Today, Times of India, DNA, Hindu, Mint, Femina, and many more. She has 20 plus years of experience as a weight loss and holistic health consultant. She is the author of 3 bestsellers, and her most recent book is Fix It with Foods. I think that's quite relevant, and we will discuss a little bit about all of your books also. Thank you, Kavita, for joining us today.
Thank you for having me.
We have Tanya Khupchandani Vatsa. She has a master in public health from Columbia University. Apart from her current work in healthcare operations and development for Khupchandani Healthcare and HCG ICS Khupchandani's Cancer Center. She is a published author, a blogger, and an influencer. Mommy Diaries is her platform across Instagram, Facebook, and a written blog. She has written a book named All You Need to Know About Parenting. Welcome, Tanya.
Thank you. Thank you for having me.
We have Mansi. Mansi Jhaveri is a founder and CEO of the most trusted discovery platform for parenting and childcare, kidsstoppress.com, which has 10 million reach per month, and she is a mom of 2. Mansi has emerged as the one of the strongest influencer in the parenting and baby care space. She offers online courses for kids, women, entrepreneurs, hosts India's first parenting original podcast on JioSavan. Her first book, 50 Indian Meal Plans, ranked number 1 on Amazon.in. So thank you, Mansi, and thank you all the panelists for joining us today.
Thank you. Thank you so much.
So I would like to begin with, Mansi, with you only. How mother can make a healthy cooking and eating a fun and meaningful part of the family routine?
Well, my experience is only precisely 11 years and 10 months old. So I'm going to talk out of straight from there. And I think what I did early on was connected. And if you guys are following both Kids Stop Press and me on my personal handle on Instagram, you will see that I connected my kids very early on with food, in terms of right from where it comes from to the whole life cycle and the process of it, right? So they've never had a love-hate relationship with food. I think that's the first premise that I established. They never feared food. They looked at food as an essential. They looked at food as not as medicine but healing. Because otherwise typically हम लोग क्या बोलते हैं कि अच्छा तुमको सर्दी खांसी हो जाएगा हल्दी वाला पानी पियो. Like, I was just listening to my daughter's online school lessons this morning, and all the kids were discussing their morning routine, and one child saying, Miss, I drink turmeric water every day, and one child is saying, Miss, I drink turmeric water with cinnamon every day. And these are 7-year-old children, guys, we're talking to. So it is amazing the level of medicines from kitchen and awareness that has come about with this pandemic. But for my children early on, couple of principles that I established was I got them involved very early on with farming, with gardening. We have a little kitchen garden. So they understand the process, that it's not, food doesn't come out of packets. It comes out of your own kitchen and your own garden. That was one. They never feared food. They looked at food not as an essential to survive, but as healing, and food as medicine. And food is all the medicine that you literally need. So I think that was very critical. They always associated food with happy memories. And again, like I said, if you're following me on Instagram, you'll always see, like typically every Saturday, I always share a recipe of my mom that I have created, because that recipe, that food item, it could be like Saturdays in a Gujarati household is typically bajre ka roti and urad dal with bengan bharta if it's in season, right? Now for me, it goes back to memories of my childhood or how my mom prepared it. Therefore, involving my children into the process and associating food with happy memories, right? Food is not supposed to be looked as protein, carbohydrates, fats, and things like that. Of course, you need to know the reason behind every food item on your plate. but they never, and that was one of the biggest reasons that's how I inculcated it. And last is I never spoke of weight loss or fearing weight as a metrics of of my health or my immunity or a measure of, they've seen me exercise every single, and for every follower of Kid Stop Press and who's been following me in the last 8 years of Kid Stop Press will know that I'm a big advocate of yoga and, leading a very, very holistic life. So they have seen me right from the time that they were in my womb because I was doing my headstands and handstands even while I was pregnant. So they've seen that transition from the time that before they were born to even now, that a holistic life or healthy living, exercise and food go hand in hand. So I think कुछ ingrain किया है और कुछ उन्होंने देख के सीखा है that listen, if you need to do this, if you need to live a healthy life, you need to put in the efforts for it. So I think that's my transition to understanding and keeping the corridors always open for conversation. So it's never been like my way or the highway. It's always been, let's discuss this if you don't like something. And I'm never a mom who sneaked in the food and made green dal and red dal and yellow dal and whatever. I'm not judging anybody who else does it. But I was a full-time working mom and I just did not have the luxury of time to ever do that. So my kids always had to see the palak as a palak sabzi and not as palak, like ground and put into the dal and sneaked it. So whatever works for you guys, it's got to be a experience that works for you and the health of your child.
Absolutely, Mansi. I agree with you. So, according to you, the mantra is holistic life, holistic life or healthy, living, and start early with kids so that they also adapt what you want to inculcate in them.
Yes, and most importantly, for them to know that food comes out of plants and not out of packets. I think that's because they do farming pretty much every weekend with me, and they totally know the hardships to even pluck one millet out of the ground. Unko pata hai kitni mehnat lagti hai. So I think that has really helped them understand the value of food.
Absolutely, Mansi. I completely agree with you. Kavita, I would like to hear your views on the same.
Yeah, so I agree with almost everything Mansi has mentioned because, frankly, that's exactly how I grew up as well. Growing up, now when I look back, I realize how logical and commonsensical, my household was in terms of eating and the food that was being prepared. I've mentioned in all my books also that my first nutrition teacher, I now realize, was my mom, because growing up, she would ensure that we would eat healthy food, which was tasty. And that's the principle I learned from her, and that's the principle I've taken forward in all my writings, all my speaking, and with my child too as well. He's now much older. I'm probably the oldest of you lot here, but so he's beyond my control is what I'm trying to tell you now. But what I've tried to do is I've tried to merge taste and health together, because I personally believe that that's the only way for it to sustain, for healthy eating to sustain. You can't push the food down your throat if it is not appealing to you. I realized that when my mom would make it her mission, frankly, Nikki, to ensure that we eat all the veggies, all the fruits, but she would find a way in which we would like it. Like I still remember I fell in love with sprouts when she made it eventually in a very nice tamarind and yogurt mix. And that's how I still like to have it. Otherwise the children don't usually take to sprouts. Similarly, she made it her point to make my sister like peas, which she hated. So taste and health have to go together. You have to keep that in mind, and you have to understand and respect a child's taste as well. That's the first thing I would like to add here. The second, I totally agree with Mansi that sneaking in nutrients or sneaking in fruits and vegetables that you think are good for your child only works up to a point. Up to maybe the point that the child doesn't really start thinking himself, like 2 to 3 years old. In fact, the younger you begin with them, to start talking to them about food and the value of food and what really right food can do to us and what harm the bad food can do to us as a general conversation. Don't make it like a class. Don't make it sound like a sermon. Let it be like a regular conversation topic in between, between a mother and a child, or a father, the whole family together. Maybe I, in fact, also suggest to a lot of my talks that maybe pick up one vegetable or one fruit a week and just figure out some fun way of trying to give information about that food to the child in that week, and cooking that too as well. So that's the second thing. So sneaking in is not a great idea. Being upfront about it, talking to the child, telling them that spinach will do this for you. Tell me, how would you like to have it? How should I make it for you? Would this work? Fine. I'll find another way to make it for you. I understand time can be a constraint. You can't really always take out time to cook so much, but the effort, a little bit of effort goes a long way. That's the second thing. The third thing I feel, which is very, very important as far as immunity building and the health building of children is concerned, is for the mother to be very aware of needs, nutrient needs of children at different ages of their life. Small children require certain set of nutrients. Growing children require certain different sets of nutrients. And preteens, like women, girls, preteen girls or teenager girls will require more iron, for example. An athlete child who's really active in sports will require a little extra protein. So bringing in, for example, sattu in that child's diet would be a wonderful idea. So this is also very important, being a little more aware of what your child's needs might be, and then tailoring the food accordingly and tailoring the conversation around that, I think is very, very important. And finally, one last thing that is actually for the media that I want to talk about, and also for people like us who talk about, messaging or who give out messaging all the time. All the messaging out there, like be it for immunity, be it for superfoods, be it for staying healthy, is targeted at adults, Nikki. I feel for example, we keep harping all the time that haldi doodh is good for everybody. It'll keep you safe. It is brilliant for your immunity. Like for example, Mansi was mentioning 7-year-olds having haldi pani. I bet they are not enjoying it, for one. So we need to make sure that when we're giving out messaging, for example, for immunity, or if we're talking about haldi in this case, probably we can also talk about stuff that will work for children. Haldi can be had in many ways. A simple messaging I give out when I talk to children, or to a group of mothers who have young children, is you don't have to force haldi doodh or haldi milk or haldi water down their throat. Or you could probably just try and make small laddus, of haldi, jaggery, ghee and flax seeds. Tiny little laddus, one laddu a day, which they'll enjoy eating as well. Make a ritual out of it, that they do it after every lunch or something. It'll take care of their healthy requirement, and it won't be a task to make them have it. And also they will enjoy. That is what I'm trying to say. The messaging we have to take it to the children. They are the future. Their health is important. So the messaging also needs to be, I feel, tailored a little bit more. These are the 3 points I wanted to make, Nikki.
Absolutely, Kavita. So it is important to make the food appealing and interesting and a fun way. So I would like to hear Tanya's thought, and I'll again get back to you, Kavita, because I got a very good question I want to ask. So Tanya, what's your views how a mother can make healthy cooking and eating fun with meaningful part of the family?
So, I have to start by being upfront and saying that I myself am a very fussy eater. I'm one of those eaters who my mother will still try and sneak in the vegetables for, because it's just, I'm the type who will pull out the kothmir from my food. So I think that makes it even, especially because they're at the dining table with us and meal times are together, that they see that I'm also making an effort, but that this discussion is had with them. It makes communication even more important, because we have to discuss a balanced meal. My son, who's the older one, we regularly sit down and talk about, like, what are the proteins, what is the dairy, if I make a change to his meal plan, or like reduce the milk and add something else, they know why these decisions are being made. During this pandemic, particularly right in the beginning, actually, we had an incident where he had extremely high fever, and we had to just right in the beginning in March, before like testing was as quick as it is, before things were as streamlined as well, and we had to isolate alone, just my son and me, for 2 days while he was tested. And so he's been through it, so it's very important to have that conversation, to tell him
Tanya, we are not able to hear you. Tanya, we can't able to hear you.
Nikki, is it better?
Yes. Now.
Okay. Yeah. So the entire thing was a very scary experience for him, which is why it's even more important to make sure that communication is key with your kids, having family meal times. A lot of people, a lot of my followers on Mommy Diaries regularly ask me, what if we give a screen at lunchtime, and that makes the whole mealtime easier because they eat whatever they're served. But I feel in the long term, and this is what studies have shown as well, is that this just inculcates unhealthy, in that they're not an active decision maker in what they're eating. They need to know what they're eating, they need to be conscious of it, and they need to be able to accept their body's cues, so that if they're full, they can say when to stop, when to go on. And similarly, that need to be had with them.
Absolutely. Okay. Fine. Got your point. So, Mansi, you were saying that we should not sneak what the kids are eating. It's not a good idea. But every child is not like that. Many times they are not understanding. If I talk about the majority, most of the parents will complain that their kids are fussy eater, and I believe all three of you will agree with me. Right, Mansi, you design diets also. I'm sure you must be coming across most of the parents who will complain that their kids are not eating. Though I'm lucky in that part, my kid is quite a though he's 2.5 years old, the elder one is 8 years old, still they are quite a conscious eater. They eat sprouts, healthy milk and everything, and they enjoy it. But everybody is not like that. All the kids are not like that. How to handle such situation? I would like to hear from Tanya first, and then I'll get back to you, Mansi.
So in a situation where they're not the best eater, what's worked beautifully for us is rewards charts. And this doesn't mean you're bribing them to eat, because you don't have to keep it based on getting a goodie or getting a sweet. But for us, on a daily basis, on a weekly basis, we sit down and we decide these are the goals for the week. So number one will be doing your homework every day. Number two will be going to sleep on time. There's always something about eating your fruits and vegetables as they're served. My daughter is a slow eater. She tends to hold her food in her cheek. So that becomes a part of the rewards. And this is actually something that moms approach me about, like on a daily basis. I had a conversation about this yesterday. It really does work to tell them, okay, if you get 5+ stars this week, we do something fun on the weekend. Don't keep it bribe-based, keep it activity-based, because that makes it a lot more palatable for them and for you as a parent. But for us, punishment doesn't work so well. Rewards works beautifully. That's also something that digests a little bit easier in terms of mom guilt and being a more accepting parent and an accepting version of yourself as a parent.
Absolutely. Thanks, Tanya, for your thoughts. So, Mansi, I would like to hear from you on this.
One is, I completely agree with Kavita that you need to respect your child. Giving you an example, my kids don't eat any fruits, right, except the mango. And I realized this early on because my elder one didn't eat, my younger one didn't eat. I came to terms with it, and I said, "What is?" And I did not even try to sneak it in. I said, "Jab hoga that," and I asked my doctor, is it okay? And he said, as far as they're eating all the vegetables, that's fine. My younger one was lactose intolerant. She couldn't have any sort of milk. She can have milk products, but she can't have milk in its purest form. And we discussed it, and she knows what the effect of that is. So she does not have any milk, while the elder one is okay. So we as a family have gone dairy-free as far as milk is concerned. Other forms of dairy, because we're vegetarian, is okay. The reason I'm saying all of this is that my kids are not perfect. But we need to stop doing this as parents. As agar tum ye khaoge tum अच्छे बच्चे हो, अगर ये तुम नहीं खाओगे तुम नहीं. Stop labeling your kids. Okay, there are no good and bad children. I don't know anybody who does love every single food item, right? But what was important was keeping. And I've never incentivized my children to eat anything. I honestly, I just didn't have the time or the inclination with the amount that was happening to say, okay, you get, you'll be rewarded with this or you'll be punished with this, because I did not compartmentalize it that way. And I did not want my children to bear the burden of saying, I'm not a good kid because I'm not eating something. It was very clear that, and literally I speak to my kids as adults, dude, you're not eating this. Are you going to eat this? Because this is what is required. But honestly, with the relationship that my children have with food, it has never reached a point that I need to say, listen, if you don't eat this, you're going to get injections and you're going to be hospitalized and whatever. So food is never associated with a very, very traumatic situation in the first place at all, right? So that kind of worked really brilliantly for us. And what I've designed, which is called the 50 Indian Meal Plans, which is the book that we've published, is not a nutrition or dietitian's plan, because I'm not I'm not what Kavita is. She is educated in that field. She's an expert in that field. I am a mother who's posed with the question at every evening from my cook, ki bhabhi 5 baje baj gaye, aaj khane mein kya hai? And to just battle that question, to battle the guilt of not knowing what my kids were eating at 4 p.m., I started devising these meal plans, saying that, listen, I need to know if I'm not at home what my kids are eating, and to just ensure that they're consuming their sprouts first and then their chips or then whatever else that they want. Because uske baad agar tum wo ek bowl sprouts kha loge na, fir itna sa bhook bacha hoga that can fill in the junk, right? And I never tell them that this is junk and this is and I must say a little story here. I always tell my kids the cycle of the food. So my kids, and people will find this really hard to believe, have never eaten those smiley fries. To the extent that they've embarrassed me at one point in time when they went to a party where they told the host who was serving those smiley fries that, auntie, it's very wrong of you to feed children something that is cooked 21, at minimum 21 days prior and frozen, and then you've just refried and given it to us. I don't think you're doing right. And I just did not know where to look at that moment. And I was like, oh my God, can these innocent kids not spurt it out just like this? But for me, I don't want to tom-tom that my kids have never eaten those smiley fries. But what it reassured me is that you're never going to be with your child making the rights and wrong choices all the time, right? As far as what you've told them kind of resonates with them at the decision-making point, you've done a good job as a parent, right? And especially with, like, my almost 12-year-old who thinks that everything that's coming out of a packet is actually cool. For her not to go into that extreme has been very, very rewarding. So I think for me, it's never been about judging that agar tum haldi pani pi rahe ho, you're a good kid. If you're not having it, you're a bad kid. Please do not label your children or do not incentivize them to believe that if you will do this, you will get this, because that's always a stick and carrot approach, which will always make them run after that carrot. Khaoge to carrot, varna lakdi, right? So I think that has typically worked very well from the parents that we interact with at Kids Stop Press, and both with my kids.
Absolutely, Mansi, I agree with you. And I would say Tanya and you both are going in a different direction. So it's a quite interesting discussion going on. Kavita, I would like to hear your views on the same.
So I, in fact, will tread the middle path here for you. I'll do the job for you, Nikki, because there are different kinds of parents. Why? Because there are different kinds of children. Every parent would understand their child and take the path that works best for that child and for their circumstance and for their family, So there is no right or wrong path, as long as, like I insisted right in the beginning, you have to take the child with you. The child has to be on the same page. You can't be thinking something in your mind and just, implementing it, expecting the child to keep following it all the time. As long as you're talking to the child and making the child understand as much as they can along the way, they won't understand 100%. Even adults don't understand 100%. What adults? As a nutritionist, as a dietitian, I have no shame in saying that we have probably just scraped the 1% of the nutrition knowledge in the world.
Kavita, I would like to interrupt you and ask, because this thing, I believe one of you also mentioned before that Mansi said that I will, talk to my kids and they will understand. But the understanding of the kids will not come before, 5, 6 or 7 or before that. not before that, right? But how to handle the young kids? What about 2 years old? What about 1 year old? What about 4 years old? They will not understand this is iron, this is protein, this is vitamin, this is carbohydrates. Or
this because till they're about 2, they're not even fighting back with you, right? It's just like at 1.5, 2, what do they do? That's all they're going to do, right? They may like it or they may not like it. So also important that sometimes, and when you go into this a little deeper, I'm sure Kavita will be able to, will be the best person to speak about it. It's also sometimes understanding your child's rejection to certain foods, right? Yeah. Because the child is also not feeling that great, after consuming something, or when you are forcing down food, your child, like my younger one never took to milk like my elder one did, right? She always had that little bit of aversion, and then it kind of aggravated. So if you listen to your child, it will kind of work very, very well. And I completely get it that till 2, what are you going to do, right? But what you've done till 2 is going to pay off after 2, right? So that is going to be the big impact that is going to happen. And I'm not kind of opposing what Tanya is saying, that there's no extreme. What I was saying is, in my case, it was a very specific case where my child was lactose intolerant, or she did not have fruits, right? There was a very specific case. So I had to kind of say, okay, these are the options. If you're not having dairy, how are you going to work on your B12 and your B12 especially, right? So that's the conversation. So even if I would reward her, there was no way that I could still fill that nutritional requirement which was there. So that's why that conversation was a best mechanism than anything else.
Absolutely agree with you. I would like to hear from Kavita. Kavita, I would request you to please complete what you were saying and you were adding. You want to add something?
What I was trying to say was that I totally agree with you, Nikki and Tanya and Mansi, that till about, even I would say in fact till about 3 or 4, when the child is really under your control and you can make the child eat what you want them to eat, it is fine to even sneak in vegetables at that point of time. But thereon, the moment you realize, and for every child that age is different, that the child could try and understand now, and I can start introducing some conversation, you must begin. Because the earlier, the better, literally is what I'm trying to say. I write books, presumably for adults, right? My first book was Weight Loss, Don't Diet. The second book was Ultimate Grandmother Hacks. And the third one is Fix It With Food. Now, both these last 2 books, Nikki, they are for an adult market, presumably. My publishers are, targeting it for adults, for people like, you, me, and my friends. But how I write it, in my mind, is that I'm writing for the next generation. Both of these books are actually for the mothers to actually pass it on to their children. I would like, if the child doesn't read these books himself or herself, what I would love actually is, and then the purpose of the books will be met, is that the parent reads out a chapter a day. For example, a chapter from Ultimate Grandmother Hacks, where I talk about how it is so important to sit together as a family and eat. If a mother and a son, or a father and a son, or a father and a daughter can sit together and just read that chapter together and maybe discuss it, frankly, my job will be done. Because just the mother reading or the father reading the chapter is not going to solve the purpose for me. Our generation is still aware of certain good habits and we are hanging on to them. I am very worried about the generation which is coming next. Because we probably haven't done a very good job of making sure that all those good habits, continue on to the next generation, because this generation has not really made it easier for us. See, I'm coming from a different wavelength from you all. My child is much older. My child is 22. So what I'm trying to say, I've told you my age, by the way, by saying that, but what I'm trying to say is that it's important for information to be given to the child. So when I'm writing a book for the adults, my language is such that it can be read by a teenager, and that it can be read by a mother or a father to a pre-teenager or even a 7-8-year-old. Because frankly, when you read information and you keep drilling it in a light, fun way to the child, some of it will stick to the child, is what I'm trying to say.
Absolutely agree.
If I may just add, I think what we do as parents is we take away, every child is born with this innate ability of intuitive eating, right? As parents, we kind of take that away from the child, like get a 6-month-old or 7-month-old baby to feed more than he actually wants, you will not be able to. Get a child to eat more than what he wants, you will not be able to, because they are born with that innate ability to eat, to have the power of intuitive eating. We actually force feed our kids and then take them away, and we are the ones who are saying that ice cream is yummy and broccoli is not, right? When we stop treating ice cream as the superior food and stop making broccoli the victim each time, it will make, like, if we start as parents treating both broccoli and ice cream as the same in our heads, it will be a completely different ball game altogether, right? Because then the child is not thinking कि A star लेके आए तो ice cream मिलेगा और D लेके आए तो broccoli मिलेगा. Literally put like that. So if you stop as parents doing that discrimination, if you're eating your cookie, enjoy your cookie. If you're eating your broccoli, enjoy that broccoli, right? So all I'm saying is that give that child the ability to decide how much is too much, and give that child the ability to understand what is his intuitive eating power, and do not kind of force feed that child at each point in time. I think that'll make like a significant difference. And as Kavita very rightly said, that in her book how she's spoken about what read it with your children. I think that is something that we kind of when we make our weekly meal plans as a family, me and my girls together, we kind of balance it out. Acha, ek din if we've eaten the pasta, we've also, acha, theek hai, wo dinner mein banayenge, to lunch mein we'll eat this. You are empowering your children to make that choice. By the 21st day, your child will reach a point and she will say, "Ki, Mummy, if we're making pasta for dinner, let's have roti, sabzi, dal or sprouts in the evening." But that is going to come only if you trust your child and you're intuitive with your child. And age does not matter. It's not something that's going to happen at 7, 8, 9, 10. That can happen even from the age 2, 3, 4, 5. The minute your child can actually communicate.
I completely agree with you, Mansi, because as you are discussing the meal with your children, with your kids, it's they are also feeling a part of it, and they think that, okay, we have decided mutually, now we have to have it. So mutually, family discussion on the food, it's equally important. And trust me, my 2-year-old eats broccoli and salads like anything. He enjoy equally as he enjoy ice cream. So
as tum to fir sorted ho, you are sorted. You have nothing to worry.
Yeah, no, but this discussion is for the other viewers also who are watching, and I'm sure they will also get a lot of insight from our discussion. So Tanya, I would like to hear, as a mother, which superfoods that you add in your daily diet, in your and your kids' daily diet.
So, something that we started including during lockdown is exactly what Kavita said, like honey and haldi in a delicious preparation that they actually like, just to kind of boost the immunity. Because frankly, to continue the conversation that we were having, every child does not accept, even if you tell them that this is better. And my daughter has just turned 4. If I ask her if she wants, and they decide their own meals, but given from like a menu that we suggest. So do you want palak paneer? Do you want anda roti? Do you want something? And if I give them that option at every meal would be chicken nuggets or keema or some of the yummier things that they've tried and experienced, and that adapt to their palate, which is fine because every child is different and every family is different. But at the same time, I think we have to give them options. Like Mansi said, when you're planning a meal, plan it for the day in that, okay, you've had this for breakfast, you've had this for lunch, for dinner, these are your options, choose from one of the above, so that it's a family discussion and it's decided together. So the same way they know that haldi is for immunity, they have to have that in the morning. Their milk has been switched a little bit from cow, they're having less cow and they're having more almond milk. So these decisions have been made as a family to kind of boost the immunity during lockdown. There's a little bit more garlic and ginger added into their food. So we are trying ghee is one of them as well. So easy ways to put it into their food that they actually like, enjoy, and know.
Absolutely. Kavita, I would like to hear your superfoods which you add in your and your kids, though he's 22-year-old, but still.
Yeah, so I mean, my book has 40, so you can take your pick from there. 40 superfoods. But personally, I
revise a couple of them for our viewers.
Yeah, sure. See, everyday foods, yeah, literally everyday foods. I just make sure that one, of course, haldi and ghee. These two, most definitely, and a little bit of tulsi leaves in some form or the other. There are 5 things that I do for sure. One haldi, one tulsi leaves, one some amount of ghee every day, one definitely a lot. I've always been a black pepper lover, but now I dunk little extra black pepper into everything that I eat and everything that I probably make for my son. So my son suddenly finds his eggs more black these days, you know, the fried egg, but that's okay. As long as he's getting his egg without having to make it himself at this age, this is a compromise he will probably have to make. So these are the foods that I've been trying to, on an average, put in my daily diet. But otherwise, as a general rule, what I'm trying to do is that I've even more consciously increase the amount of vegetables, the fiber that we are eating on a daily basis. So with every meal, at least one meal for sure between lunch and dinner, there is a big side serving of a stir-fry vegetable, which is assorted vegetables, not raw, because for dinner we don't really eat raw usually. It's always stir-fried vegetables and different assortment every time. So sometimes it's pepper and mushrooms, sometimes it's zucchini and French beans, whatever is available. Sometimes it's just gobi and gajar, but nicely just crunched, stir-fried. So that one extra serving of vegetable, that whatever else you might be eating for dinner is there in the center of the table, and we have to finish it. We have just 3 people in the house, so we try and finish that as well. So that is my way of ensuring that there is an extra amount of fiber and antioxidants going inside the body in a very, very natural way. And I think it's a very simple trick. Every household can adopt it. You could do it for lunch if that works better for you, frankly. And of course, fruits. I've always been very, very particular about everyone eating fruits, at least 2 servings, if not 2, at least 1 for sure. So that evening fruit has always been important, but now these days, particularly, it's mandatory. You know, because I'll be very honest with you, Nikki, this pandemic has, shook all of us. We've all realized that the most important thing to do, more than the work, more than the social media, more than anything else, is taking care of our health proactively. And somehow, the word superfood and immunity has become a buzzword. And now when you Google, the results for these 2 words are more than for weight loss. And I'm so, so glad about that, So we are going in the right direction, and we just have to sustain it. I think we'll do fine. This too shall pass.
Absolutely. So according to Tanya and Kavita, haldi, ghee, and Kavita has added tulsi leaves, black pepper, eggs, fruits and vegetables. Mansi, what would you like to add superfoods, and what do you add in your kids' diet, or what would you advise to our viewers?
So honestly, I would say there are no standardized superfoods. What we've been doing is every season has their superfood, right? Of course, your ghee, tulsi, and haldi are something that you can have it all the time. It also depends on, I'm a big believer of eating food according to the nature of your body and a little bit on the principles of Ayurveda and ancient food wisdom. So what may suit one person may not necessarily suit another person, right? So example, in the monsoons, if your local crop is your millets, then you should be eating a lot of nachni at this point in time, because it's high in iron and it is locally grown at this point in time. Example, Kavita said salads. We don't eat any sort of greens in the monsoon because they're not locally grown or they're not abundant in supply. So we are actually, I never tell my kids to eat broccoli outside ever. Even round the year, I will never tell my kids to eat broccoli because I'm just so fussy about how it is cleaned. I will never buy broccoli, gobi, all of full gobi and all of that during the monsoon months here, because of the way it is cleaned and the it's not healthy to eat it in that time. So I actually believe that every season has their own superfoods. So right now, example, if it is monsoon, it has to be your nachni, it has to be all your pulses, because your pulses will take over at this point in time more than the vegetables. But do not assume that, okay, so what is going to be my fiber intake? Whatever are, like example, sage is a vegetable which is grown, which is a local grass that is grown, and we consume a lot of that. But otherwise, we are sticking to all the creepers which you should traditionally be having in this month, in these months, which is your dudi, turai, galka, all of these, which are the superfoods of this season. So what I'm trying to essentially say is that don't bucket yourself कि अच्छा ये 10 superfood है, ये 5 superfood है और मैं इसी में से choose करूँगी. Example, she said pepper. Now I am having this water which has pepper, long, soft, star anise, and jeera and coriander seeds. Some people may want to have, and I am having it as a cooling food because my body was producing a lot of heat and I was getting a bit of breakout, so I added soft and jeera. But to somebody who's of a different prakriti and a different body type, may need to add ajwain to the same concoction, right? Because they must be feeling bloating, or they must be feeling any or indigestion or something like that. So it completely depends on your body type. Example, I always eat my salad 30 minutes before my meal because it ignites your digestive juices and fire for when the actual meal is to be taken. I will never eat raw food outside because I just have a mindset that they don't clean their vegetables properly. So like Kavita said, always stir fry them. That's the rule to go by. So I would say each season will have their own superfoods. Example, in the winters, you will get the green garlics, and winter is meant to be had for heaty foods, right? But अगर आप वो suddenly summers में क्यों नहीं grow होता है? Because it's not meant to be had in summer. No matter how nutritious or superfoodish it could be to have the fresh green garlic, right? So I would say don't go blindly by the superfoods that are described. That ones like she mentioned about the haldi, tulsi, neem, and all of these, because every season will have their specific superfood. So decide by the season and your local surroundings that what is typically best for your local produce.
So what is tropically available in the local market? Okay, so Mansi, you mentioned about drink that you are having and you made it healthy. Kavita, I would like to hear, how can we make healthy drinks options for kids? Which is healthy, yummy, and tasty.
So, I feel that it depends from child to child. There are some children who really enjoy drinks and some don't. So I'm not much of a fan for juices, especially not fruit juices. So that's an absolute no. Trying to, one thing I love to tell everyone to give their child is to mix two superfoods together. One is coconut water and one is sattu. If you mix both of these together, it makes a wonderful high protein drink for the child, which is hydrating as well. The second way to do a second drink that you could try is, if you want, if you have a child who's very active and you're really actively looking at increasing the protein content in the child's diet, then you mix buttermilk with sattu. It's such a wonderful combination, and it's an instant protein drink, which is natural and great for the child. You don't need the protein powders, is what I'm trying to say here. The third thing, if there are children, especially younger ones who don't really have the fruit, it's very easy to give them fruit in the form of a smoothie. So either you mix it up with milk, or you mix it up with yogurt, or you mix it up with anything. If you're lactose intolerant, maybe almond milk. So one fruit, one milk form, be it lactose intolerant form, lactose-free form, or regular milk or curd, and 1 tablespoon of any good seed added to it. And if you want to make it a little more calorie heavy, because some children need more energy, because you have to look at, sometimes some children need help with gaining weight as well. So you could probably even add a tablespoon of peanut butter to it. So that makes a wonderful smoothie, I think, for children. In fact, it can be like a very good evening drink for the child if there is time still for the dinner to happen. So these are the few drinks that you could try. And of course, the regular ones like homemade sharbats, the seasonal ones like the jamun sharbat, I rarely see a child eating a jamun or a falsa these days. So maybe to give them the benefit of that, maybe these sharbats you could still try with them, because at least they'll get those antioxidants inside the body. So I think these will be wonderful for children.
Thanks, Kavita. Tanya, I would like to hear your thoughts. How do you make healthy drinks, or what do you recommend to our viewers?
So, I'm not a big fan of drinks for the kids per se, especially like Nikki said, Kavita said, that there's a lot of sugar in them, and I just feel like fruits are so essential. My kids have a fruit every evening, no matter what. They can choose if it's something in season. A banana goes, all of us start the day with a banana. So I just feel it's a good way to line their stomachs this morning. We've all had oats pancakes for breakfast with banana and tulsi honey. So, a lot goes in just in that. And I don't feel like a drink is definitely necessary, but at the same time, we love it. So one of their favorites actually is a yummy homemade nimbu pani, but we're very careful with the things we add in it. So we add nutmeg, which is another really good superfood. It's something that also helps them with magnesium, it helps them sleep. So that's a great thing to add. And of course, honey. We don't use sugar, we use honey. Salt, it's a great way to balance their electrolytes as well. So instead of drinks, they love almond milk, and we always make like good smoothies out of that. So with that, peanut butter is a hot favorite in our house. So lots of nuts, lots of fruits, and there's so many concoctions you can make. I would highly recommend though, like a nimbu pani, you can even put amla in it, and they absolutely love it. Amla, nutmeg, salt, and honey.
Okay, Tanya. Mansi, I would like to hear from you on this.
Again, I'm a big fan of seasonal drinks. So I'm just going to add, our drinks will vary from Kokam Sharbat in the summers to currently they're having a lot of, and we put all of these recipe videos on our YouTube channel on Kids Talk Press, which is having, we kind of make gurkha pani and we keep it in the fridge. And we have avla, freshly squeezed avla, which again, we squeeze fresh every morning. So avla gurkha pani with ginger water and aloe vera is something that they're very used to, used to having in this period. And also also I think the biggest advantage in my case has been that that living with grandparents. Tanya has written a whole book out of it, which is incredible. But I think just living in a joint family has tremendously helped my kids understand ancient food wisdom and understand कि हर season की खासियत क्या होती है, right? So I think the grandmother has played a very crucial role in my kids having a very, very well-developed palate. So like I said, it's kokum in the summer months. It's a lot of avla in the winter months. Also, beet and carrot together in the winter months, which is traditionally how we grew up. You knew gajar was in season either if your mom made halwa or if your mom removed that painful gajar ka, there should be a separate mixie used to come to remove gajar ka juice, right? So typically, and when you know that when that comes and your mom starts cribbing about the cleaning process of it, the gajar is actually in season. So typically it works, one of those things, but every single time, and especially in the last 6 months, we've sworn by the immunity thing that I just mentioned, which is to ensure that they are having gurkha pani, because that has also a lot of iron and a lot of strength. A big caution here is, guys, that a lot of people feel that honey is very beneficial over sugar. It's very important to understand that honey should not be added hot to anything, because the minute honey is added to anything hot, it will lose its nutritional value, and according to the Ayurvedic terms, it tends to become poisonous. So it's very important that you let things come down to room temperature. Otherwise, typically people love having ginger and hot water and honey together. So it's a very important thing to note that honey should be not added to everything hot, or people add it to their oats, to make granola. You'll get a lot of store-based oats which will say add honey and it's a better sweetener or whatever. So again, this is all a lot of coming from Ayurveda. So I would just say that treat honey with a lot of caution, because while it's a great soothing drink for you, you need to have it the right way.
Okay, there is a little bit disturbance from your end, I believe. Okay, I would like to know from Tanya, Tanya, what are the quick tips you would like to give it for working mom who can include nutrition diet if they are in hurry, or some recipe, not exactly recipe, but which options will you recommend to working mom and to give them right nutrition and along with superfood?
Absolutely. So in our household, actually, since my kids were little, literally since my son was having solid foods, we've done a lot of idlis with palaks. We do palak idlis, we do beetroot idlis. Parathas are such a hot favorite. They love gobi parathas, even gobi and palak. Palak rotis and palak tikkis go down really easily. The kids love that, and they know what it is. They know what they're eating. They know what's healthy, and it's an option that they prefer to choose when you ask them what they want to eat for a meal. If that's on the menu, they will take that. So strongly recommend all of those. And also dosas. You get such amazing batters now, and you can also make ragi batter, nachni batter at home. We actually grate dudi and grate carrot and put it in the dosas. The kids call it their sprinkle dosas. And these are like easy recipes to do for working moms. I know right now is a time when everyone is really overwhelmed, even for mothers, not just for kids, your nutrition and your mental health. And there's some things that have kind of taken the back burner. But I think it's important to prioritize yourself first at this point, because only then can you take care of your kids. And that's something I want to tell every mother who's listening, is not to put themselves on the back burner for too long, because the situation seems to be here for a bit. So prioritize yourself for sure. And of course, when it comes to your kids and their nutrition, there's some easy things you can do, but also look at your own health and your nutrition as well.
Certainly. Thank you. Kavita, your view.
Yeah, so she's almost mentioned almost everything. I would just like to add one thing here, which is if you can, frankly, if you can just get your household to love khichdi, that's the best way to ensure a meal that works for everyone, which gets made in a jiffy, which is so easily digestible, which gives you complete protein, and you could do variety. It's the perfect vehicle to add vegetables as well. So that's one meal or one dish that I would say, one pot meal that can work wonders for working women, both from the point of view of ensuring nutrition for the family and herself, and also because it's a little easier, of course, and gets ready absolutely in a jiffy. You don't really have to source too much also. So that's the one thing that I want to most definitely add here. And second, I would like to second Tanya, you as a mother, you can't forget about yourself. You have to put yourself first. See, only a happy mother can ensure a happy family and a healthy family as well. So unless you take care of your own health, because health is not just about, aches and pains or feeling tired, the physiological changes. Not eating right or not taking care of yourself also shows up as mood swings and depression and fog and ability to not able to concentrate. And all of that is going to affect the way you're going to parent your child as well. So it's important to take care of your health, take care that no deficiencies, long-standing deficiencies develop during this time. I keep telling everyone, this is the time when all of us are developing deficiencies we're not realizing. And the pandemic will go as it will, as everything goes away. But we must ensure that on the other side of the pandemic, we are healthier than what we were before it. We can't be worse off, And for that, the woman has to take care of herself as she does of the family.
So women has many role to play, and they are the role model for their kids also. So Mansi, I would like to hear from you. You are a perfect role model to your kids. You are saying you are adapting the same things, and your kids are doing, and they are fan of good food, and you have a culture at home. So please advise to our viewers what kind of if they want to add something quickly, what kind of recipes they can opt for.
First up, make sure that you subscribe to the Kids Top Press meal plan, because you will get a meal plan every single Sunday in your inbox. So that is very important. Second is make sure that you get our book from our website, because that has 50 Indian meal plans sorted for you, so you don't have to think. Third, which is I think taking from what Tanya and Kavita said, is that make sure that you take care of yourself. because अगर supposing you made this really elaborate dinner, पर अगर इतने गुस्से के साथ बनाया कि मैं ही क्यों घर में सब काम कर रही हूँ, why am I the only one, ये क्यों नहीं खा सकती हो, why can't you just make do with a khichdi? So you're anyways transferring so much negative energy into that food, so that food is really not worth it. Fourth is get your kids to cook. Trust me, the nakhras will all go away the minute they start cooking, the minute they start doing the bartan. Honestly, in this pandemic, I have done it all with my family, and all the minute we would actually decide on recipes just depending who's doing. The person who does the dishes for the day decides the menu, because it's as simple as that many more vessels will happen. But jokes aside, I think Kavita said it, that get them to stop from day one that your child is born. Please. And I'm sorry, from the time that your child is going to eat separately, I mean, it's going to start on food, on external food besides breast milk. Make sure that no separate meal is being cooked. And, because we have people right from, and when my younger one was born, my grandfather used to live with us. So 0 to 80, the same meal was cooked. So choice नहीं होता है कि नहीं मैं ये नहीं खाऊंगी, separate one for this one, separate one for that one, separate one, because you would drive yourself up the wall. We had this meal planning template and we would plan for the week. If you want something, it is added to a next column which we actually stick on the fridge, which is called a wish list, which will help every single mother actually plan the next week's menu. So if you want your child to say throw tantrums, so no problem, आप जाके wish list में add कर दो, फिर next week के menu में include होगा. Guys, this will also tremendously help your child to respect other people's opinions. You may like a khichdi and I may like a pasta. So if grandfather is coming halfway through eating a little bit of pasta next week, you better eat what he or she likes, right? So food is actually teaching our children so many other things besides just food, right? And I think that and when they cook, they also understand the effort that goes behind the chopping, the cutting, and the pureeing of things. So I think when they start seeing all of that, that will make a lot more sense. I would say that for working moms or stay-at-home moms, making food is just as important task, and why only the moms, even the entire family, right? Guys, make sure that you plan, make sure that you batch your food, make sure that you kind of and when I say batching, is batching in terms of can you do your can you do your sauces in terms of your ginger garlic paste, your mirchi ka paste, all of that over the weekend? Can you do your chutney sauces, etc. over the weekend? So you can create things which are much faster. Also, like I would say that batch your food. So if you can cook dal for 2 times instead of 1 time, if you do not have house help, that will help. But make sure that you're not cooking too much in advance and storing and freezing food, because then you're losing the nutritional value of the food. So let's have food in the way it is supposed to be had, and just let's kind of make sure that we're subscribing to all that I just said.
Absolutely, Mansi. Thank you, Kavita. I would request all three of you to give us one mantra from your books. All of you. So you all three of you are author. I would request Kavita you to begin with. I'll come to Tanya and then Mansi. So Tanya, I would like to hear one mantra from your new book.
So my book, actually, the crux of it is that, just to give you some background, I had my son when I was living completely alone. My husband was in school and working. We were in New York. And so my parenting style has always been very, very hands-on, which is exactly what my book is about. It's everything from sleep to food, but keeping you as the mom in mind, and the journey that you go through, and tips and tricks to make the whole experience very simple to you. So it's called All You Need to Know About Parenting, because that's exactly what it is. It's A to Z from parenting, from toddler breakdowns and tantrums to feeding them and giving them to sleep. But the crux of it is that it's very intuitive. It's intuitive parenting, and it keeps the mother at the center of it, keeping in mind that parenting is what comes easily to you. It doesn't have to be forced. It can be overwhelming, but it doesn't have to be. So it's okay to take it one day at a time, to put yourself in the center of it, and to treat it intuitively. I think that's something that's important for every mom to know. And even when it comes to food, I think that don't force it, communicate with your kids, give them options, and you'll be fine and well on your way to healthier meals.
Okay, thank you. Kavita, your views from your books.
Okay, so I was mute. I'll begin again. So I have a standard message going on in all my writings, not just my book, even when I speak. Really, I have three major mantras. So my whole philosophy just is, seeped into these three mantras. First is never, never ban a food. Just eat more of the good food and eat less of the bad food, and you'll be sorted. That's the first mantra that I believe in, and that's there in my first book, Tone Diet. The second mantra that I believe in is that eat everything in moderation. Everything in moderation. You'll be fine. That's one word that you need to remember, moderation, and you'll do good all your life. Teach that to your children and they'll do good all their life. Do not forget that you need to eat like your grandmother. That's what I keep telling everybody. Eat like what your grandmother did, not like what somebody else's grandmother did, maybe sitting in Japan or sitting in Italy or sitting in Russia for all that matter. So that might be good for them. What is good for you is what has been, what our genes are used to and the old habits that have stood through the test of time. So all those are listed in my second book, Ultimate Grandmother Hacks. And the third rule, variety. Frankly, if you can just remember this word, more variety is equal to more health. You are sorted. And for variety, I don't just mean by fruits and vegetables. Variety in your grains, the more kind of grains that you eat, that is better for you. More the variety in your dals, the more the number of dals you eat, it's good for you. Variety in, of course, your fruits and variety in all your vegetables. With oils too, I tell everyone to do the same. Keep changing your oils. So variety is the third rule that you need to remember. And this is there in my third book, Fix It With Food, where I've listed 40 everyday superfoods. All these 40 foods you will find at your local sabzi wala. So if you're hampering after kale, my book tells you that you can get more vitamin A from sweet potato, your humble shakarkandi. So that's the kind of message I want out. That it's great to have kale if you can afford it and if you can source it once in a while, why not? That too is a superfood. But having that shakarkandi or giving your child that shakarkandi chart will make sure that the child will get enough vitamin A for the eyes. So the point is eat variety. So these three rules, if you can just follow, you probably don't need to read my books.
Absolutely.
Kavita, very few authors would say that. Huh?
I'm okay with that.
And for that.
Okay, so I will quickly summarize what all we have discussed. So we should decide with our kids what we are going to cook, and that's the best option, and make them understand what we should eat and what we should not. And we as a mother, as a role model, so we need to tell them what we are eating and they need to eat the same. So thank you all of you for being here and telling us superfoods which are easily available in our kitchen, like haldi, ghee, tulsi, black pepper, eggs and all, and highly recommended by Kavita and Mansi for regular vegetables and the fruits. I would like to give a small disclaimer to all of our viewers that except Kavita is a nutritionist, but one size doesn't fit to all. Before opting for any diet, please discuss with your pediatrician and with your doctor. Then only take a call. We all are experienced mother and discussing about how we are using these foods in our daily life. So thank you all of you. Thank you Kavita, Mansi, Tanya for being here. It was a wonderful discussion.
Thank you.
Lovely. Had fun. Bye-bye.
Thanks. Bye.
Welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious Vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A.R.T. advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. Artist has also laid emphasis on lending emergency care and medical aid to women during childbirth. Artist has closely worked with the national body FOGSI and international body FIGO. The skill transfer by Artist is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
The world moves on buttons and clicks. Smart lights adore our homes. Digital locks guard our information. And green tea is our Shilpa's ready-to-use green tea fast-dissolving films eliminate food-grade plastics altogether. Refresh, recharge and rejuvenate with the world's only ready-to-use green tea films today. For more info, visit www.shilpaotc.com.
Bara, 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 ho bara. 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 बारह से नीचे मुझे चैन ना आवे, दिल धक धक होवे, सांस फूल जावे. बारह से ऊपर हो तो जान में जान आवे, चेहरा खिल जावे, सारा काम हो जावे, फिर सब कुछ लगे प्यारा, जीवन जैसे बहती धारा, सबका मैं बनूं सहारा, क्योंकि मैं हूँ मोर देन 12. 12, 12, 12 हो 12. 12, 12, 12 हो 12. 12 के नीचे मेरा दिल घबरावे, बाल झड़ जावे, चेहरा पीला पड़ जावे. 12 से ऊपर तो बात बन जावे, शक्ति आ जावे, सांस दुगना हो जावे. मिल गया खुशियों का इशारा, खुद को मैंने फिर संवारा, खुल गया सेहत का पिटारा, क्योंकि मैं हूँ मोर देन 12. 12,
Even I am more than 12, which means that the iron content in my blood is more than 12. If it's less than 12, then we are anemic. And being anemic is a hazard for every woman, for her health and for her pregnancy. Let's make India anemia free and take the first step today by taking a blood test. The iron in your blood has to be more than 12.
The world moves on buttons and Shilpa's ready-to-use green tea fast-dissolving films eliminate food-grade plastics altogether. Refresh, recharge and rejuvenate with the world's only ready-to-use green tea films today. For more info, visit www.shilpaotc.com.
Welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A, R, T, advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. Artist has also laid emphasis on lending emergency care and medical aid to women during childbirth. Artist has closely worked with the national body FOGSI and international body FIGO. The skill transfer by Artist is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
A very good afternoon to everyone present with us today. We hope that you all are happy, healthy, and safe at your home. I am Satvik.
And I am Princey. Today we welcome you to the third day of Bharat Nutrition Week, a mega movement initiated by the Integrated Health and Wellbeing Council on the occasion of the World Nutrition Week. The entire week is packed with a lot on insight on the nutrition and good food. We talk about some of the serious issues India is facing on hunger and malnutrition among the newborn children, adolescents, and pregnant women. We also address how we can achieve the target of Poshan Yukt Bharat with better agriculture and food ecosystem. As a part of this mega movement, we welcome you all again to India's biggest virtual quiz on nutrition, the Bharat Poshan Premier Quiz, क्योंकि खाने में है दम.
The quiz is initiated by ISW Council and presented by World of Wellbeing. And we thank Asian Research and Training Institute for Skill Transfer, Food, Drugs and Medico-Surgical Equipment Committee, FOGSI, and MCure for their support and knowledge for the quiz. Special thanks to our communication partner, Teamwork Communication.
Let's play the Bharat Nutrition Week video. We have also captured some glimpses of amazing and exciting first 2 days of the quiz. We would love to show it to you all. So can we please have the glimpses of day one?
As a part of this mega movement, we welcome you all again to India's biggest virtual quiz on nutrition, the Bharat Poshan Premier Quiz. क्योंकि खाने में है दम.
And the theme for today is vitamin C and vitamin D.
So now let us see how much our next generation knows about this vitamin.
Oh yes. Let's start with our day 2 and round 1. So the first question we will throw to our first team, the calcium warriors.
Vitamin C is also known as A, acetic acid, B, citric acid, C, nitric acid, or D, ascorbic acid.
Ascorbic acid. Ascorbic acid, sir.
And the correct answer is
D, you're absolutely correct.
Yes. So the next question is for DC champions. And here's a question coming up.
What is true about vitamin C? Is it a fat-soluble vitamin? Is it a water-soluble vitamin? Can it be stored in the body or does it dissolve fat?
I think it should be B. Yes.
The answer is B and you guys were correct.
All right. Like anemia fighters? All right. So
Great.
anemia fighters, here's the next question for you. What is the source of vitamin C? A,
I think that
B, meat, C, dairy products, and D, fresh fruits and vegetables.
I think that it should be D, fresh fruits and vegetables.
Yeah, I also go with D.
The answer is indeed D. You
Absolutely
are
correct.
All right, immunity boosters. Are you ready?
Yes.
All right. So the question for you is,
What is the function of vitamin C? Is it the formation of collagen? B, is it neural function? C, protein metabolism? Or D, hormone synthesis?
I think it is
I think A, formation of collagen.
right, so you answer right now. And the answer is indeed A. Correct.
Absolutely correct.
Next question is for Protein King. The question is coming up right now.
Vitamin C increases absorption of A, magnesium, D, zinc, C, vitamin D, iron.
And we'll go with B.
All right. Answer to the question is
Oh,
D.
shit.
Actually, guys, vitamin C has been shown to enhance iron absorption. So the answer for this question was iron.
So the next team is Health Crusaders. Health Crusaders, are you ready?
Yes, sir. Yes, sir.
All right.
Yes,
Health
sir.
Crusaders, your question is coming up right now.
Disease caused by deficiency of vitamin C is
A. Scurvy. B. Anemia. C. Rickets. Or D. Night blindness.
We'll go with A. Option A. We'll go with A. Scurvy.
So the answer to the question is it is A. indeed.
you're absolutely correct.
The disease caused by deficiency of vitamin C is indeed scurvy.
For this round, after this round, or the third round, what are the scores?
So, calcium warriors, anemia fighters, immunity boosters are at 30. Right. And protein kings, health crusaders, DC champions are at 20.
Okay, they're not that far away from each
Yes.
other, guys. It was great playing with all of you today, and we will see you tomorrow for our third day. This was so exciting.
Yes.
I can barely wait to start the third day.
See, this is a test of our next generation. Test of food practices, test of habits, and a test of knowledge of nutrition.
Let us begin by explaining the format of the quiz again.
Yes.
The quiz will take place through 6 days. This is already our third day. Each day has a theme of its own. There are 6 teams with 12 students in each team. Here are our most awaited teams. First is the Calcium Warriors. The second, DC Champions. The third, Anemia Fighters. Fourth, Immunity Boosters. Fifth, Protein Kings. And sixth are the Health Crusaders. 3 students from each team will get to play on any particular day. Total of 18 students will be participating in the quiz on any day. Students will keep shuffling so that all of them get to play the game. The teams that score the highest in the first 4 days get to go to the semi-finale on the 5th September. And the top 2 teams will compete in the grand finale on 6th September.
All right. So now that we're clear with that, now coming to the questions and scoring. There will be up to 5 rounds every day. Today, we will be playing 5 rounds.
Right.
Each team will be asked 1 question per round.
Okay.
10 points for a correct answer, and there is no negative marking. The time limit for answering the question will depend on the round. We will have questions at the end. Can you all mute your mics, please?
Please mute your mics, guys.
All right. So the time limit for answering the question will depend on the round. Each team will be asked 5 total questions today and will be scored out of 50 at the end of the day. Our team will keep the time, the score, and monitor the quiz. So Princey, what do we have in the store for the audience today?
We thought let's make things a little exciting for the audience today. Today we will ask the audience 1 question after every round, and 1 lucky audience member with the correct answers will get a reward.
Wow, that is fantastic. I am already so excited. So let's begin the Bharat Portion Premier Quiz 2020. Kyunki khane mein hai dam. All right. So this is the day 3 and the theme for today is?
Anemia.
All right. So what exactly is anemia?
I have been explaining the concepts on the first 2 days, but today I have decided I will not give an introduction of this topic because I don't want to give the participants any sneak peeks or hints into the answers of the question.
Okay, then let us begin the third day of our most anticipated Bharat Portion Quiz 2020. Let us start with the round 1.
Absolutely, Satvik. Let's begin. Can you please share the screen with the question?
Can you ask the participants if they're ready?
Participants, are you ready to have fun?
Yes, ma'am.
Let's not make it too competitive, but also let's have a lot of fun with each other. Are you ready, guys? Tell me you're ready.
Yes.
Ma'am.
Yes,
ma'am.
Okay.
Let's begin.
Yes, all right. So coming to round 1. So the first team for the question is,
The Calcium Crusaders.
Calcium Warrior.
Oh, Calcium Warriors. I'm so sorry,
Alright.
Calcium Warriors.
So, all right, are the Calcium Warriors ready for the question?
Yes, sir.
All right, all the Calcium Warriors are requested to unmute their mic, show their video, say a little hi so that we know you're here, and then we'll ask you the question.
Hi.
Okay, so all the 3 Calcium Warriors are here?
Okay, the first question to you, Calcium Warriors.
All right. The first question is, hemoglobin is made up of A, carbohydrates, B, proteins, or C, lipids?
Kevin,
I think it's B.
B.
Proteins.
You can discuss.
You can discuss amongst yourself, guys.
Okay, so go with
Hemoglobin is a protein.
Okay, proteins.
All right. Do you want us to lock B?
Yes.
Are you sure about it? Should we go ahead with it? Okay,
All
great,
right.
guys.
Locking B, and the answer is?
The answer is B. You're absolutely correct, guys. Hemoglobin is made up of protein.
All right. All right. The next question is for DC champions.
DC champions, show us your faces, unmute your mics, and say a little hi.
Hi. All right. So the question for the DC champions is,
The richest source of iron is A, meat and liver, B, milk, C, vegetables, or D, eggs.
Shashank Bhaiya, meat and liver.
I think it's A. Meat and
Meat
liver.
and liver.
liver. Yes.
Meat and
are you confident?
Yes.
Do you want us to lock A?
Are you sure, guys? Should we lock A?
Yes. Yes, ma'am.
Okay, great. Let's Satvik see if A is the answer.
The answer to the question is, it is
You're
A, meat and
absolutely
liver.
correct.
The richest source of iron is meat and liver. All right.
Congratulations, guys. 10 points to you in this round.
All right. Moving on to the next team, anemia fighters. Unmute your mics and show yourselves.
Hi, sir.
Hi. Hi.
You ready?
Okay. So the next question to you guys is,
Substances which does not improve iron absorption are A, vitamin C, B, acid secreted by stomach, or C, phytic acid.
what does not improve iron absorption?
Amongst these 3. You can discuss, guys, amongst yourselves.
Unmute yourself
Unmute
and
yourselves.
discuss.
You have to unmute yourselves.
What do you think?
I think it's C.
Guys, are we talking on C?
Anemia fighters, are we locking on C?
I think vitamin C is not the correct answer, so I think we should lock on C.
Yeah,
Right,
we
lock
should
on-
lock on C.
All right. Seeing the answer now, Princey?
Yes. Let's see the answer for this question.
And the answer to the question is, it is C, phytic acid. Congratulations.
Vitamin C, like we learned yesterday, if we remember, helps enormously in the absorption of iron.
Yes.
So do some acid secreted by the stomach. So phytic acid definitely is the answer.
All right. So the next question is for
The immunity boosters.
Immunity
Let's see the
boosters.
next question for immunity boosters. Guys, can you please show us your faces and unmute your mics?
just say a quick hi. All the immunity boosters.
Okay, great.
All
Hi.
right.
Hi,
chalo.
sir. Hi. So the next question for you guys is,
Normal hemoglobin levels in women are A,
13 to 15 grams per 100 ml, B, 12 to 14 grams per 100 ml, C, 10 to 12 grams per 100 ml, or D, 9 to 10 grams per 100 ml. What is the right answer, guys? You can discuss among yourselves.
I think it's option A is B. B.
But I think it is C.
I'm not sure. It's option A, I think.
Guys, let's get sure and lock on an answer.
Yes.
What is your opinion?
I'll go on B.
B. Are we locking B then?
Guys, what do you say?
Immunity boosters. Are we locking on B?
Sir, please lock C.
Locking C.
Is everybody locking C?
I'll go with B. We should lock B.
I think it's option A.
Guys, let's come to a conclusion.
Yes.
I'm with B.
Option B.
Okay. So, should we see the answer, Princey?
Guys, should we lock this answer for you?
Yes, ma'am. Option B.
All right.
Okay. Let's lock on 12 to 14 grams per 100 ml and see if that's the correct answer, guys.
All right. The answer is correct.
You're absolutely right. 12 to 14 grams per 100 ml are normal hemoglobin levels for women.
All right. So the next question is for Protein Kings.
Protein Kings, are you ready for your question?
Unmute your mics and show yourselves. Hi.
Hello, ma'am. Hello.
Question to you is, where do you check for anemia? A. Eyes. B. Tongue. C.
Palms and soles. Or D. All of the above.
I look on B, all of the above.
Answer
I also all of the above.
no. Yes.
Wait for a second.
All
wait for a second.
of the above. Yes.
Yeah, I'll also go with all of the above.
Yes.
Okay,
Yes.
guys.
Yes.
If
All
you
of the
lock
above
an
is right
answer, are you sure about D? Should we lock on it?
Yes.
Yes, ma'am.
Okay, Satvik, let's show them the answer.
And the answer is?
A.
The answer is D.
Guys, that is all of the above. We do check for anemia in eyes, tongue, palms, and soles.
So absolutely correct.
Let's move on to the next question for
Health Crusaders. Health Crusaders, are you ready?
Yes,
Hello. Yes.
Okay, great. Let's ask the next question to the Health Crusaders.
And the question is?
How does anemia affect the body? A. Blood becomes thin. B. Blood doesn't deliver enough oxygen to the body. C. Tissues retain fluids. D. None of the above.
Rehan, I think it's B.
Shortness.
I think it's B. Rehan. Because hemoglobin
B?
level decrease. Right. B. B. We'll go with B.
Okay, guys. I think we're locking on B, isn't it? Lock on
Yes.
B?
Yes.
Okay,
All
Patrick.
right.
Let's see
Locking
the
B. And the answer is? The answer is B. Correct.
Absolutely correct. While a person gets anemia, the hemoglobin levels of the blood reduce, and that's why blood doesn't deliver enough oxygen to the muscle tissues.
All right. And that was our first round. Himani, can we have the scores for the first round?
So every team has scored 10 points each.
All right. Congratulations,
Wow.
teams. That's really nice.
Playing well and competitive, huh?
All right. Ready for the next round? Here's the next question for Calcium Warriors. Calcium Warriors, are you ready?
Yes, sir.
Okay.
Okay.
And the next question is, anemia causes spica, which is A, difficulty in studying, B, not able to sleep, or C, craving for food.
I know this.
Play, uncooked, rice, etc.
It would be C.
C. It's C.
Okay, guys, are you sure we should lock on C?
Yes.
All right, locking C. And the answer is?
You're absolutely correct.
Yes.
Pica is a condition in which we crave for non-nutritional things such as clay, uncooked rice, metal, etc.
All right.
And chalk. A lot of people ate chalk in
Yes.
school, right? I did.
And sand.
And sand.
All right, the next question is for DC Champions. DC Champions, are you ready?
Yes, sir.
Yes.
Okay, here's the question.
Most common cause of anemia is A, iron deficiency, B, vitamin B12 deficiency, or C, calcium deficiency.
Iron deficiency.
A. Iron deficiency.
A.
Okay, that's pretty confident. Should we lock A then, Princey?
Should we? Should we, guys?
Yes.
Okay, let's
locking
see
A.
the answer.
The answer is C.
No, it's
Okay,
A.
all right. The
I'm
answer
sorry,
A.
that's a mistake on my part. The answer is A. Iron deficiency is the most common cause
All
of
right.
anemia.
So Himani makes sure they get this point. All right. So the next question is for anemia fighters.
Anemia fighters, are you ready? Today's topic is anemia. You should be more excited than that.
Yes, and this letter be correct. So the next question coming up is: can anemia be hereditary? A, yes, or B, no?
Yes.
Yes.
I think it's yes.
Yeah, it's yes. It can
Okay,
be.
should we lock on yes, guys?
Yes. A.
Yes, ma'am.
Yes. Okay, great.
And the answer is correct.
Anemia, a lot of forms of anemia can actually be hereditary.
All right.
So you get 10 points, anemia fighters.
Yes.
Celebrating your name, aren't you?
And the next question is for which team?
Protein Kings. Protein Kings, can you please unmute yourselves and show us yourselves?
Yes, ma'am.
Yes, yes,
Aye.
Great. Let's throw the next question to the Protein Kings. Which of these are signs of anemia? A, pale gums. B, decreased concentration in studies. C, weakness. Or D, all of the above.
D, I think D is the correct answer for this question.
No, it would be C, weakness.
No, I think all of the above.
D only. People are having pale gums also. They
Yes,
can't concentrate while sitting even for a
No,
second.
no,
It would be D itself.
Yes, D is
Yes, it will be D. All of the above is the correct answer.
Yes,
All right.
it's
Should we
D.
log D?
Should we log D, guys? Yes, ma'am.
Okay, then lock D.
Yes.
Okay. Log
Yes,
D then. Should we see the answer?
Should we see the answer, guys? Are you sure about it?
Yes, sir.
Yeah, sure.
Okay,
All
let's see the answer, Sarthik.
The answer is D. Indeed, you are correct.
All of the above is the answer. All of these are signs of anemia. You can have pale gums, you can have decreased concentration in studies, you can have weakness because there is less oxygen supplied to your body.
All right. So the next question is for immunity boosters. Immunity boosters, are you ready?
Yes, ready.
Yes, sir.
All right. So the next question coming up right now. How does iron deficiency anemia affect teenagers? A, more trouble with written expression. B, can't concentrate. Or C, aggravates hyperactivity. Or is it D, A and B both options? Or is it E, C and A both options?
Complicated.
Yes.
I think it's E.
I think it's C. Like, I think it's a D, A and B.
What are you guys saying, guys? Should we log? Which one should we log on?
You guys can discuss.
Guys, what do you think?
Immunity boosters.
Let's come to a conclusion. How does iron deficiency anemia affect teenagers? The kind of anemia which is caused due to iron deficiency, how does it affect the teenagers? Do they have more trouble with writing, or they can't concentrate, or it aggravates hyperactivity? So, or is it A and B both, or is it C and A both? Come on, let's come to a conclusion.
It can be D also.
Yeah, it's D, I think. A and B.
All
Okay,
right.
should we log on D?
Yes.
Fine, logging on D, Satvik, let's
All
see the
right.
answer.
The answer to the question is D. Indeed, you are correct.
So you have more trouble with written expression and you can't concentrate.
But it does not aggravate hyperactivity.
It cannot aggravate hyperactivity because blood oxygen is less in supply.
All right. So the next question is for Health Crusaders. Health Crusaders, are you ready?
Yeah, we
Yes,
are ready.
We are.
Okay. So the next question is, which of these groups is most likely to have anemia? A, men.
Older adults. Rehan, older
Women.
adults.
C,
Option D.
teenagers. Or D, older adults.
Older adults.
We'll go with option D.
Very confident of you. Should we log D?
Yes,
Let's
yes.
log D, guys. Are you sure we should log D?
Yes. Option
Okay,
D.
locking D. And the answer is B. Women are most likely to suffer from anemia than men, not older adults.
Is that
All
true?
right. So that was the end of our round 2. Himani, can we have the scores, please?
So, except Health Crusaders, 10 points to each team.
All
Okay.
right.
And what is the total score of round 1 and 2? Actually, let's total the scores at the end.
Yes,
right?
we'll total the scores at the end.
Absolutely.
All right.
So, wait a second. We haven't been asking the audience questions.
Yes.
2 questions to the audience from our side now.
Okay.
So, the first question to the audience is, anemia can contribute to which of these among older adults? A. More falls. B. High blood pressure. C. Diminished eyesight. Or D. Diabetes.
So our audience can write their answers in the comment boxes and one of our teams will get to them. Okay.
Guys, please do not answer here.
Okay, so all right. So audience is already answering.
The participants cannot answer, guys.
And the participants cannot answer. DC champions, you cannot answer. This is for our
Sorry,
audience.
my bad. Sorry.
Yeah, all right. So the audience, I think the audience must have answered.
I think the audience must have answered.
All right. So the correct answer to the question is A. More false. Correct. All right. So do we want to throw another question for our audience?
Let's throw another question and then let's throw one at the end of the quiz.
All right. So another question for our audience. Audience, buckle up. This is another question for you. Iron deficiency anemia is common in adolescents with A. Asthma, B. What is it?
Bulimia.
Bulimia. C. Heavy menstrual bleeding, or D. Obesity.
What do you think, guys? Participants do not answer.
I don't think Mabesha doesn't participate. All right. So I think the audience must have answered by now.
Probably. Let's give them like 10 more seconds.
All right.
10,
9,
8,
7,
6,
5,
4,
3,
2,
1. And the
I
answer
hope, guys, you've answered.
All right. The answer is C. So whoever in the audience has answered heavy menstrual bleeding will be contacted by our team and will get their reward.
One lucky winner.
Yes.
Okay, guys, let's move on to round 3.
Let's move on to round 3. Are the teams ready? Calcium Warriors, here's another question for you. Are you ready?
Guys, let's get a little more excited
Yes,
about
Calcium Warriors.
Woo! Okay, Calcium Warriors.
All right. Here's the question for you.
As a part of which national program adolescents are given iron and folate supplements? A. RMNCHA, Reproductive, Maternal, Neonatal and Child Health Adolescent Strategy. B. JSY, Janani Suraksha Yojana. Or C. JSS, Nari Shishu Suraksha Karyakram.
A.
I think it's A.
Okay, guys, I think we're logging on A. Are you sure we're logging on A?
Yes.
Yes.
Okay, great, guys.
And the answer to the question is A. You are
You're
absolutely correct.
The national program, which is RMNCHA, the Reproductive, Maternal, Neonatal and Child Health Adolescent Strategy. Under this national program, adolescents are given iron and folic acid supplementation.
All right, that's very right of you. And the next question is for DC champions. DC champions, are you ready?
Excuse me.
Yeah.
Guys, if it's a question, we'll take it at the end.
Is it the third round?
It's the third round, guys. Yes.
It's the third round, yes.
We've begun the third round.
All right. So the second question is for DC champions. DC champions, are you ready?
Yes.
All right. The next question is
Anemia Mukt Bharat program to reduce the prevalence of anemia comes under which ministry?
A. The Ministry of Health and Family Welfare. B. The Ministry of Women and Child Development. Or C. The Ministry of Social Justice and Empowerment.
A.
Ministry of Health and Family Welfare.
Wait a second. Yeah.
Okay, should we log on A?
Yes.
No, wait a second. All right, logging on. Are you
हाँ
confident?
भैया. Yes.
Okay.
Great, guys. Let's see the answer, Satvik.
The answer is correct. The Ministry of Health and Family Welfare is the answer.
Great, guys. 10 points to you in this round.
And
So the next team is playing?
Anemia Fighters, bring on your quiz game. The next question is for you.
Are you here, guys? Let's also show some
Yeah,
excitement.
ready.
Yeah.
Okay,
Yeah.
guys. The
Okay.
next question for you is,
Anemia is a common condition. What happens when a person has anemia? A. The body produces too much iron. B. The blood does not have enough red blood cells. C. The blood becomes thick. Or D. too many white blood cells?
It's B. It's B. I think it's B.
Yeah,
It is B.
Guys,
yeah,
looking on B,
it
are
should be
we?
B.
B.
We
All right.
go with B. It's B.
We
Yeah.
lock on B.
All right.
Okay, great. Let's see the answer, Satvik.
And the answer is B. You are correct.
The blood does not have enough red blood cells when a person is going through anemia, which is why oxygen is deficient in supply in this condition.
Congratulations. That's another 10 points to you. And here's our next question for immunity boosters. Are you ready?
Immunity boosters
Yes,
are
ready.
awesome, Satvik.
Yes.
For immunity boosters.
All right. And the question is,
A lack of which of these will result in abnormally large red blood cells and a condition called megaloblastic anemia? A. Oxygen. B. Vitamin C. C. Vitamin B12 and folic acid. Or D. Carbon dioxide.
I think it's C. Vitamin B12 and folic acid.
Yeah, it's option C. C.
Okay, guys, are we locking on option C? Is it vitamin B12
Yes,
and
C.
folic acid? Okay, let's see
all
the
right.
answer.
The answer to the question is
You're absolutely
C.
correct.
Yes.
Vitamin B12 and folic acid are both required, both are needed for red blood cells to grow to the right size and shape to carry oxygen.
Yes. All right. Congratulations. Here are another 10 points to you. And the next question is for Protein Kings.
Whoa, Protein Kings, are you
And-
ready?
Protein Kings? Hi, sir. Yes.
Yes, sir.
All right. Bring on your protein game. Here is your question. Anemia due to deficiency of iron or vitamin B12 can be differentiated based on the examination of blood cells. Is this statement A, true, or B, false?
I think
Guys, this statement is true.
I think A.
Yes,
Yes,
A.
it is a true statement. Yes.
Okay, guys,
Yes,
we're
it's
looking on A, I think.
We go
All
with
right.
A, yeah. A. True.
Okay,
Yes.
let's lock on A.
And the answer is?
We lock on.
All right. The answer, do you see the answer?
Should we see that?
The answer is A. You are indeed correct.
10 points to you guys.
Yes. Anemia can be a differential examination of blood cells. You're correct. All right. And the next question is for Health Crusaders. Health Crusaders, are you ready?
Yes, we are.
All right. So the next question is,
Routine screening for iron deficiency anemia is not recommended for adolescents with heavy menstrual bleeding. A, is it true? Or B, is it false?
True. Rehan, I think it's true.
Um,
Shreyansh, it's true, I guess. No. If there is heavy menstrual bleeding, then it should be false because people should get their, test done, screening done. So I think we should go with false.
Wait.
False.
Guys, I think you're logging on B, is it?
all right. Logging
No,
on
no,
B
no, no.
then?
Rehan, yes, it is B.
All right. Logging on B then. Prinsya, have you seen the answer?
Yes, we're seeing the
Yes.
answer.
And the answer is A. The answer is A.
Guys, people should not go for a routine screening for iron deficiency anemia if they're an adolescent with heavy menstrual bleeding.
Yes. All right. I think that was the end of our third round. Imani, can we have the scores, please?
10 points to each team except Health Crusaders.
All right.
Okay, guys. Guys, if you want to discuss the answer of any question, you have to discuss. You have to unmute your mics and tell us what you're discussing.
Yes. You cannot discuss while we are answering us. While we are questioning you with your mics muted. You have to unmute your mics. All
Are
right.
they clear to you guys? Say yes, please.
Yes, ma'am.
Yes.
Okay.
All
Yes,
right.
ma'am.
Moving on to the fourth round, should we?
Yes, let's move on to the fourth round.
Yes.
guys.
All right. Buckle up. Buckle up. I hope,
Last 2 rounds left for most of you to catch up.
yes, and I hope you're not getting tired. All right.
Okay, let's do the next question to Calcium Warriors, Satvik.
Calcium Warriors, are you here?
Yes, sir.
So,
Okay. So the next question is,
Although anemia is a significant global health issue, it is not associated with high mortality or morbidity. A, is it true? Or B, is it false?
False.
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 Okay, then.
Okay, let's lock on false, guys.
False.
Okay, Satvik, let's see the answer.
And the answer to the question is it is B. It is false indeed.
It is a cause of high mortality and morbidity.
All right. That's congratulations. Another 10 points to you. DC champions, are you ready for your question?
Yes.
Okay, and the question is
Anemia affects what percentage of the population? A,
12%,
B,
18%,
C,
27%,
D,
or 32%.
भैया 27.
ये नहीं पता.
So लो एक
No
बात.
idea about this.
मुझे तो 27 ही लग रहा है. निवेदन.
27 मुझे भी ऐसे लग रहा है 27 में.
Okay.
Okay, guys,
1.6
let's
billion.
lock on C.
Log on C then. 27%.
One second.
Okay.
27.
Okay, chalo. Logging on C. And the answer is, should we see the answer?
Yes, let's see the answer.
Answer is say 27%. Anemia does affect 27% of the population.
That's sad, isn't it?
It is quite sad.
Okay. Let's move on to the next question for
Anemia fighters. Anemia fighters, are you ready for your question?
Yes, sir.
Okay, and the question coming up right
Yes,
now.
we are ready.
A person can develop iron deficiency anemia despite of eating food that contains adequate iron. A, is it true? Or B, is it false?
I think it should be true.
Okay.
Okay.
What do the other members think?
Yes, it should be true as it.
Yeah. Yeah.
Yeah, it should be true. We should log on A, I think.
Yeah.
Okay,
We'll go
guys.
with
Now
it.
we're logging on A. Let's go ahead and see the answer.
And the answer is, it is true. You are correct.
Even if you eat food that contains a lot of iron, you still can develop an iron deficiency anemia.
All right.
Let's move on to the next question for
Immunity boosters. Immunity boosters, are you ready? Yes, I think the immunity boosters are ready. All right. The next question for you is,
iron tablets cause constipation. A, is it true? B, is it false? I don't want constipation.
Yeah, neither do I.
I think it's false.
No, I think
Yeah,
it's
I
true.
also think it's false.
Okay.
Okay, guys, let's see if the answer is
Wait, wait. I think it's true. Yeah.
okay.
Wait.
It's
Do you
true.
want to
Me too.
Yeah, I think it. I'm sure it's true. Yeah, I'm sure.
Okay. Option A.
Okay, guys,
Lock
let's
on
look
A.
at option A and check if it's correct.
And the answer is A. It is true.
Iron tablets can sometimes cause constipation. Again, I don't want it.
But you don't want anemia either. Then. Okay.
That's correct.
All right. So the next question is for Protein Kings. Protein Kings, are you ready?
Yes.
Okay, so the next question for Protein Kings is
Hookworm infestation can result in anemia. A, is it true? Or B, is it false?
Yes, it's true. I think it's true.
We should. I also. I think it's also true. Yes, A or.
Okay.
I think if we guys are locking on A,
All right. Logging on A. Okay. We see the answer?
we should see the answer.
The answer is A. Correct. Hookworm infestation can result in anemia.
Okay, so the next question for Health Crusaders. Health Crusaders, are you ready for the next question?
Yes.
Okay. Karthik,
Yeah.
the next question for Health Crusaders.
Health Crusaders has a question. 1 second. Yes. I think that is about all the.
Thank you.
Oh, I think that's about it. Are we done with the quiz, Karthik?
I think we should have a couple more extra.
Okay. Let me check. Guys, give me a second.
Yes. Can you take the screen for a second?
Yeah, sure.
Give me a moment.
Himani, can we show the scores for the last round till then?
Yeah, but Health Crusaders haven't had their question yet. So
we're giving them a few questions
yes. All
just
right.
about now.
Yes. Give me a. All right. Yeah. So the question for Health Crusaders is.
Wait, you have to share the screen. Just a second.
All right, Health Crusaders, can you just buckle up and get your quiz game up till we pull up a question for you?
Sure.
Yes. Okay. Okay, okay.
So I think this is the last round that we are playing, and the next question for Health Crusaders
All right.
is beefy large tongue and anemia occurs in A. Vitamin D deficiency, B. Iron deficiency, C. Vitamin C deficiency, or D. Vitamin D deficiency.
If you want, we can present the answer for you.
Yeah, please,
Please
present the question.
present the screen.
Let me. Yes. Here is the question for you. And this is the question for you. All right, can you see the question? Beefy large tongue and anemia occurs in A. Vitamin B deficiency, B. Iron deficiency, C. Vitamin C deficiency, or D. Vitamin D deficiency.
Iron. I think
Okay.
iron deficiency.
We will just give us a minute, please.
Sure.
Yeah.
I think it is option B.
Guys,
It should be iron deficiency, right? It's option B.
okay. So we're locking on option B, is it?
Yeah.
All right, I'm so sorry, but the answer to the question is vitamin B deficiency, as I know of it.
Yes, vitamin B deficiency causes a sort of anemia, causes beefy large tongue, and that would mean that you don't get your 10 points in this round.
All right, so that was our 3 rounds for the day. I'm sorry, due to some technical difficulty, could not hold the further 2 rounds. And that was about it, that we had 3 rounds today. Can we have the score of this round, Imani?
I think it can never be better than getting a test cut short, is it?
I think that's pretty good news. You signed up for a 30-question test and we just told you it's a 15-question test. So that's really good for you.
Treat.
That is our gift from our side.
Satvik and Princeton, I think we had 4 rounds today.
Oh yes, we have 4
Yes,
rounds.
we had 4 rounds.
This
Yes,
is fine. This is last round down.
So
Can we please have the final scores for today?
Fine. So calcium warriors and fighters and immunity boosters are at 110.
All right.
Right. DC champions are at 100 and
Okay.
protein kings health crusaders are at 70.
Okay.
Protein Kings and Health Crusaders, you've got to buck up
Yes.
tomorrow. We'll see if you can catch up with the rest of the teams. Otherwise, elimination, guys.
All right. It was really nice playing with everyone.
Excuse me. Hello. Can I ask a question?
Concluding the quiz for today, guys. It was great playing with you all, and we will see you tomorrow again after all your preparation. And it's the 4th day tomorrow, so we will be eliminating 2 teams. So prepare your best, and we will see you
tomorrow.
Bara, 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 ho bara. 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 बारह से नीचे मुझे चैन ना आवे, दिल धक धक होवे, सांस फूल जावे। 12 से ऊपर हो तो जान में जान आवे, चेहरा खिल जावे, सारा काम हो जावे, फिर सब कुछ लगे प्यारा, जीव जैसे बहती धारा, सबका मैं बनूं सहारा, क्योंकि मैं हूँ more than 12। 12, 12, 12 हो 12, 12, 12, 12 हो 12। 12 के नीचे मेरा दिल घबरावे, बाल झड़ जावे, चेहरा पीला पड़ जावे। 12 से ऊपर तो बात बन जावे, शक्ति आ जावे, सांस दुगना हो जावे। मिल गया खुशियों का इशारा, खुद को मैंने फिर संवारा, खुल गया सेहत का पिटारा, क्योंकि मैं हूँ more than 12। 12, 12, 12, 12, 12।
and I am more than 12, which means that the iron content in my blood is more than 12. If it's less than 12, then we are anemic. And being anemic is a hazard for every woman, for her health and for her pregnancy. Let's make India anemia free and take the first step today by taking a blood test. The iron in your blood has to be more than 12.
Welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A, R, T, advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. Artist has also laid emphasis on lending emergency care and medical aid to women during childbirth. Artist has closely worked with the national body FOGSI and international body FIGO. The skill transfer by Artist is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
The world moves on buttons and clicks. Smart lights adore our homes. Digital locks guard our information. And green tea is our ready-to-use green tea fast-dissolving films eliminate food-grade plastics altogether. Refresh, recharge and rejuvenate with the world's only ready-to-use green tea films today. For more info, visit www.shilpaotc.com.
Welcome to the Healthy in Khayega India show. Today we really had amazing time with multiple sessions, talk shows, and our very entertaining Bharat Poshan Premier Quiz. So now is the time for some really healthy tips. So on third day, we have a very special guest today. She is being really good with food, and and very exciting recipe she has, especially for fussy kids. And she plays around a lot of with nuts and a lot of green veggies, and very creative cook. And she also has her own. She's entrepreneur actually, and she has her own setup where she also introduce a lot of new recipes for kids. So her name is Shalini Santosh, and welcome Shalini, and let's have fun today. And a lot of people in audiences are waiting here to see your new recipes. Exciting because in lockdown time, people get really bored and they can't just go out, don't trust people outside because of hygiene and safety. If you can really give some good tips, they'll be really very excited to cook something at home.
Sure.
So what do you have special today for our audience?
Sure. Thank you so much, Rajiv, for introducing me. And today because we have a 30-minute session and I wanted to do something for kids. I wanted to make it very easy. I mean, cooking is easy, nutrition is easy, and we can make very fun things with traditional ingredients, but presented in a modern way that
Wow.
kids, can like it. So all the recipes that I'll be showing can be made in within 5 or 10 minutes for kids, because kids get hungry, every now and then. So instead of allowing them to munch on some other, chocolates or snacks or cake,
Quick bites, some interesting new things. They always
yeah.
keep.
Yeah, they want something new, they want sweets, they crave for sugar. So things like that I wanted to show you.
How do you play with millets? You said there's something you do with millets also. There are a lot of new things.
Yeah. I mean, millets, of course, those will take time. There are so many things. I generally make a millet idli or dosa. That's my favorite, my family's favorite. There is no rice that is used, and it is really nutritious. It has so many minerals. You can make a ragi dosa batter with any millet. It's the same recipe, and you don't need rice for that. So it's just millets, a little bit of urad dal, and poha we use for softening it. And that's it. Soak it overnight, ferment it, and your batter is ready. So I'll not be showing that today, but since it's going to take time and it takes more than a day to ferment and stuff. But
let's
I'm
see
sure
what do you have today.
Yeah. So the first recipe is a dessert. Okay, it's a very interesting dessert, and as we want all our kids to have dry fruits, right? We want our kids to eat nuts, and they don't eat the whole nuts, so there needs to be a creative way. And I thought kids like jam. They like eating the biscuit with the jam. So I thought I'll show you something to make a jam out of nuts, and that too sugar free. Okay, without any refined sugar, and made in like 2 minutes. Okay, so I'll show you the first recipe. So I have this dry fruit powder. Okay, so this dry fruit powder is made from almonds, cashew, pistachios, watermelon seeds, whatever dry fruits you like. Roast it, powder it, and stock it, every week or every 2 weeks or whatever. Make a fresh batch. So I have this ready with me. Okay, to this I'm just going to be adding like a spoon of honey.
Wow.
Okay, use use a good honey, use raw organic honey, because honey is something that's very good for immunity for kids, right? So it's important that you choose the right honey. Go for raw organic honey. Um, what you mean by raw is that the honey is not actually heated. And when you heat honey, the commercial honey, when you heat it, it loses all the properties, the medicinal properties of honey. So go for something that's raw. So as you see, I just mixed honey, okay, with the dry fruit powder. And I'm going to just mix it well. It will be sticky, just like jam.
Yeah.
And it will be sweet also. And to this, I have it ready. Okay. I'm going to just take a biscuit, any biscuit. So at Early Foods, we have, biscuits that we make from jaggery and millets. But you can take any biscuit, any good healthy biscuit that you want. So
The jam is ready?
yeah,
Oh wow, it's so quick.
yeah. And all you have to do is just spread it out. Okay. And I'm adding more because kids like the more jam.
I can just have it like that.
Yeah. And it's very, and then, just the presentation wise, you can add your favorite fruit and it's ready. Like, you can add strawberries or you can add grapes, you can add banana or whatever. And
So
it's ready
quick and
to eat.
fast.
And it's just so quick.
Really
And it's very filling. I mean, if
fast,
you have a
healthy,
good,
filling.
it is filling because there's not nuts and there's honey.
Yeah.
So, yeah, good ingredients in one go.
Very healthy snack, and the best thing I like, you can just roast some nuts, as you said, and keep it. So whenever you want, just add organic honey and best quality honey what you have, and just it's just ready for you. And you can just put it on bread, biscuits, and give it to
Yeah,
kids.
you can put it on bread. The same jam, you can roll it into a chapati, roll it, have it. Yeah, a
This
number
is
of
for
things.
anybody. This is for anybody. Like even working,
Yeah.
at work, you can just quickly have it.
Yeah, and we don't need any reasons now to crib that. Oh, time nahi hai, मैं अच्छा नहीं बना सकती, कुछ healthy नहीं बना सकती हूँ, because it's so quick. Give me
I'm
a
really,
second, I'll wash my hands.
yeah. So it was so amazing, to see quick, fast recipe.
Yes, so another thing about honey I wanted to share these days, the commercial honey that we are getting, right? So bees generally make honey from flowers. We all know that. And that's why it is so medicinal, because you don't tell a bee which flower to go, which tree to go. It's very raw, right? And it's unprocessed. That's why it's like so medicinal. But these days in the beehives, the commercial honey, and because we need so much, there's so much of need of honey, what they do is in the beehives, they keep artificial sweeteners, ready sucrose, ready fructose, that the bee gets attracted to thinking it's sweet flower. And there's no medicinal value at all, So
How do we
that is why.
identify then this is a good, healthy honey? What is this?
Sorry?
Tips. Well, how do you identify then what is good honey? Which one is good?
So I think these days, nobody, I mean, there is less adulteration, but generally I think the honey doesn't dissolve so quickly. So that's one of one of the easy ways to identify it. It does not. It is very sticky. It is thick. And when you consume it, you really get a very rustic flavor. You don't feel like you have just eaten sugar. You have to feel there's something different about this honey just by tasting it. And of course, you will have to look at who's running this? Is there any background? What is the company doing? Things like that we'll have to decide before buying honey.
So what is next, Shalini? What next you're showing us?
So next, I'll be showing you a coconut roti, okay, a sweet roti. So I'm emphasizing a lot of food with good fats, okay. That's because coconut, fresh raw coconut, okay, is very good in fats. And fat is important for the child because the brain is made of fats, and most of the brain development is made below under the age of 5. Like at the age of 5, I think 90% of the brain development is over. So you want to ensure that you are giving the right material to build the brain, right? So that's why the emphasis on nuts. That's why the emphasis on coconut. But yeah, I'm going to be showing a simple stuffed coconut roti with jaggery. Okay. I hope you can see me. I already have my dough ready. I've not even grated it. I have taken coconut, cut it into small pieces, put it in the mixer, and I have shredded coconut ready.
Oh.
So I'm just going to stuff the coconut, okay, and I'm going to add a little bit of jaggery. Okay, I get jaggery powder. Okay, or you can use sugar. It's okay. Use a good quality sugar. I prefer to use jaggery.
Normal brown sugar also?
Yeah, you can. But I prefer to use jaggery because it's more richer in iron. Okay, and I'm just going to make this into a stuffing. Okay. And we are so used to parathas, it is as simple as that. So this is, instead of a vegetable filling, I'm just giving it a coconut filling. It can be like a dessert also.
This is interesting, this north part of India. I think people will really love it because we, especially North Indian, and people here are very used to having aloo parathas in the breakfast, and that also very heavy butter. So that's a normal trend. This will be a really healthy change for people if they try it.
Yeah. So the thing about this roti is you can put coconut, you can put the same dry fruit powder, stuff it with some jaggery or sugar. You can put, I generally put some flaxseed powder in it or some curry leaf chutney powder. So I just make it a little more, enriching it with a little more of the...
It can be sweet also and spicy also.
Yeah, it can be sweet or spicy. So I'm just putting a little bit of ghee to cook the paratha or the roti. So another thing that I wanted to share about cooking the roti is always ensure that when you're putting oil on this chapati, right?
Okay.
Don't cook on a very high flame. So generally we want it fast. We want the rotis faster. We want it to cook it faster. Right? So
slow flame.
Cook it on a slow flame. It should not smoke. So the moment the oil smokes, you're kind of losing all the nutrition in it. It's kind of turning into something else. So even if you buy the best organic cold pressed oils in the market and you cook it in a wrong way, it's not going to work because Yeah.
Which oil you're using? This is some normal refined oil, or you prefer some
No, this I'm using ghee. I'm using ghee,
ghee,
but
desi,
you can,
pure ghee?
yeah, ghee. We make homemade ghee from butter, from A2 milk, and then I need to reduce the flame a little bit since I can see it's already hot.
The worst
Yeah,
part
so
is I can't taste here. Actually, I can see it is very yummy sounding, and
yeah, it's done. So you can serve this with. So it's done.
this could be amazing tiffin for kids.
Yeah, it could be a tiffin for kids. You can serve this with honey, or you can give it just plain. They will just roll it and eat it
So
because
easy.
it already has the jaggery in it.
So this is
Okay.
quick, fast.
Yeah,
The best
a
thing is
simple dessert with
at home
coconut.
anytime you can cook.
Yeah.
And
Okay.
healthy breakfast too.
So if you have seen in festivals, we generally have puran poli and stuff. Have you heard of that?
No.
No? Okay. Puran poli in South India, it's called Opattu and stuff. Generally during festivals, we had coconut-based rotis and stuff. So you can eat this any day, whenever you want.
Yes.
Okay. So let's go to the next recipe. Okay. So
Okay.
this is a very, very traditional recipe. It's called a curry leaf chutney powder.
Curry
Okay,
leaf chutney powder. Okay, that's my
yeah.
favorite.
So nobody eats curry leaves these days, right? We put it in our tadka and seasoning, but then when it comes to our mouth, we just keep it out. But curry leaves is something that is extremely beneficial. It's very, very high in calcium. Will you believe that it has about 6 to 7 times more calcium than milk?
Oh,
Yeah.
amazing, healthy, nutrients. Very good.
Yeah, and Rujita Divekar also speaks about this, that why are we not eating curry leaves? Make the chutney powder out of it, and or put the curry leaves in your chutneys and stuff, or make a masala out of it, but don't ignore it so much. We give very little importance to curry leaves. So since it has very high calcium, as I said, more than 6 to 7 times more than milk. Okay, milk is something that we fuss with kids so much. You don't need
Appetizer also, because what I feel, sometimes I've seen that you have good aroma of curry leaves. It is very refreshing. And I've seen in most of the South India, curry leaves are, kind of lifeline of the food. You can see that aroma. So I think we lost her internet connection. We will just wait for her to come back. And she left her, this internet is gone on a very wrong time. Curry leaves are really tempting. And I was looking forward to see something interesting. So we had two recipes till now. One was dry fruits, roast it a bit. That's what Shalini said, and keep it. And then just mix honey, some good quality organic honey, and make jam, healthy jam, and then a very healthy paratha, coconut paratha. So both are like quick, fast, amazingly home-based recipe, especially for kids. They can use in the tiffin as a snack, as a breakfast. And we have Shalini with us. Her internet connection is back. Shalini, over to you now. You left us at a very your internet connection gone at a very wrong time, and I
Yeah,
could just see
sorry about that.
all of curry leaves in your hand.
Yeah. So I'm making this, you can see chana dal, and I have some red chilies. Okay. You can, if you think it's too spicy, you can reduce, you can avoid it if you want. So I'm putting some chana dal and I'm going to roast them. And I'm also going to put some watermelon seeds. Okay.
Very healthy.
You can put any nut. Okay. Like you can put almonds, you can put walnuts, you can put sunflower seeds, you can put any seed just for the crunch. And actually curry leaves is a little bitter.
Any nut
So,
which can be eaten.
yeah. So curry leaf is generally very bitter. So just the chutney by itself, a lot of people might not like it. So just to bring down that taste, we add nuts. So I'm just going to roast it a little bit with the iron kadai, an iron vessel, not a non-stick or not a aluminium vessel. It's great if you use an iron kadai for your.
Yeah, I've heard that iron kadais are really healthy.
Yeah. So what it does is the iron content in from the vessel, okay, you're cooking, it actually seeps into the food that you're cooking, and it can increase the iron content in your food by almost 8 to 20 times. Can you believe that? And if we try and cook most of our food in iron kadais, there will be nobody who will be anemic in our country.
So simple tip and awareness about.
Yeah. So you can see that the seeds are starting to pop a little bit, especially the watermelon seeds. And to that, I'm adding a little bit of jeera, okay, and a little bit of pepper. If you're making it for babies, completely skip the red chili and just put pepper and jeera. That's enough. Okay. So pepper and jeera, roast it for some time. And add these washed curry leaves. Okay, I'm just adding it.
Wow.
So this is going to take some time. I mean, 1 or 2 minutes. But if you have any questions, you can tell me. We can talk about it while it's getting cooked.
So, property of iron, this lohe ka kadhai, I think most of the people know about it. Or I don't know. I've seen mostly aluminium kadhai and stainless steel kadhai. But I used to see this in villages, not everywhere. But I don't see in more metros and mini metros people using iron kadhai very less.
It is, yeah. So actually, there is too much of advertising done about non-stick because it's so easy. It's मतलब कुछ डोसा बनाने के लिए बहुत आसान होता है. It doesn't stick omelets or anything. So there's a lot of advertising done around it. That's why people are so crazy about non-stick. But
It is easy to handle
I think it's high time we start advertising about these traditional. These are smart, like you don't need any supplements. You don't need to eat pills. Just cook in them. But a little bit of awareness, like if we can talk about it, people will start using it.
The people who know, they use it.
Yeah. I see a lot of companies these days have come up with very good quality iron kadais. So it's all available on Amazon. I purchased them for myself too. So you have big iron kadais, you have the smaller ones, you have the pans where you can fry, make cutlets or whatever. So it's good.
A lot of people also use, I have seen mitti ka bartan for cooking.
Yeah. Yeah. That's also good.
But you have to be very careful, maintain it well.
Yeah. Worry about it getting rusted and things like that. But
Is that so?
I've been using it, and trust me, it's very simple. You can wash it normally and just apply a little bit of oil once it is washed and leave it if you're not going to use it. So that will, stop it from getting corroded or rusted.
No. And when you use it again, wash it and use it.
Yeah, wash it back and use it. Yeah. So it's
Wow.
just almost getting crispy.
So you need to just do it till the time it is crispy.
Yeah, it has to be crisp because you're going to make it, in a mixer into a powder. And this curry leaf can be the chutney powder. You can eat it with your, dosas or idli. You can make a paratha out of it, or
You can mix with rice.
yeah, you can mix with rice and ghee. Um, sometimes we are so, we are busy. We cannot cook an extra sabji. Chawal bana do. Sabji ke liye time nahi hai. So then, this comes in handy.
Just use it as a chutney. Sometimes you really don't feel like having the full meal. Then you can have the chutney and
A light dinner, a quick breakfast.
with some toast and this chutney with some chapati. With
You can sprinkle on your bread, etc. It's almost done, okay?
Yeah.
Okay, meanwhile, while this is getting ready, I'll show you, I was talking about the curd starter, right?
Mm-hmm.
I was talking about homemade dahi. So homemade dahi, we all know, is a very good probiotic. But we still buy something that's, commercially available, packed. We don't have time to take care of.
Most of the generation, they don't know how to make dahi at home.
Yeah, they don't know. So an important reason why I tell make your own homemade dahi is because you have control of the milk that is going to be used. So you can choose your own good organic milk, A2 milk, or whatever. But at least you have control of the milk. And many commercial these curd making companies, they add emulsifiers, thickeners to make the dahi thick, And have you seen it? It just doesn't shake. It is so thick.
So how you make it at home?
Yeah, so it's best, especially for children. Um, it's
Is it
best.
curry leaves are done?
Yeah.
So you use it dry. We have a question that is it you use it dry or it is wet?
So I have just washed the curry leaves and dried it a little bit, and then I'm just roasting it.
Okay. You'll mix it?
Yes, I'm going to put it in the mixer.
With little water in it.
No. It's a dry.
Okay, dry.
It's
like a powder.
like a fine powder once you put it in the mixer.
Oh.
Not a wet chutney.
Okay, not wet chutney. But if you want to make it wet also?
You can make, yeah.
Can.
But it will be very concentrated and you will have to consume it immediately. You cannot store it for a week or 2 weeks like that. The chutney powder can be stored for a longer time.
In Andhra, there's a very Andhra cuisine that is a very famous chutney, that dry powder also is called gunpowder.
Gunpowder, yeah.
Yeah. How do you make it? What are the ingredients of that?
So gunpowder is the same. but you use different dals. So you use chana dal, urad dal, moong dal, tur dal. So
So many.
you basically roast all of them very well, and then you put your jeera, pepper, salt, chili powder. Some people put garlic.
Garlic.
Garlic, and then and they roast everything so that it's crispy, and then it's made into a powder.
Okay.
Yeah. So yeah, so while this is still getting cooled, because I have to put it into the mixer. Okay. So I'll show you how to set, how to make the starter for curd. Because these days nobody sets curd at home, and बाहर का मतलब packed दही का starter मतलब use करेंगे तो दही नहीं बनेगा. Okay. That's because the microbes or the bacteria that is used to make dahi is actually changed. Okay, a little bit. They have modified or they use a different strain of bacteria that cannot be reproduced. So otherwise they'll stop making money, right? So that's why it's a completely different strain of bacteria. So if you want to make it at home right from start, so all you need is milk. Okay, it needs to be a little warm. A little more than lukewarm. Okay.
Which milk is a full cream milk, tone or
full cream? Full cream. Full cream, cow's milk, whatever milk you're comfortable in, but full cream. Okay, then only you will get thick dahi. Otherwise, you're not going to get thick dahi. So I have boiled milk and heated it. It's warm, and I'm going to just use chilies, green chilies, and I'm just going to dip it. Okay, completely. I'm going to use 2 chilies because it's a lot of milk. So chilies with this stem is important.
Okay.
That's because these stems have some bioenzymes that is going to generate the bacteria that is needed for making the curd. Okay. So if you can see,
I can see 2 chilies floating on a full cream milk, which is little warm.
It has to be more than warm.
In a vessel, stainless steel vessel.
Yeah, stainless steel vessel. And just cover it. Yeah, cover it and keep it aside for about 12 hours.
That's it. You don't have to mix little curd in it. Lemon.
No, you're making curd, na? You're making curd for the first time. It's a starter.
Okay. So
जामन जो बोलते हैं ना, जामन.
जामन.
हाँ. So the curd that forms out of this, that curd you use to make the next batch of fresh curd.
Okay. So this is you haven't put jamun in it.
No. जामन इससे बनेगा.
Oh. Okay.
So you understood, right? So this is just milk and chilies. इससे curd बनेगा. The jamun बनेगा. So we will use that curd to put it into the next batch of milk. So from then onwards, your curd can be normally done. The first time you're making and you don't have jamun, you don't have a starter at anybody, neighbors don't have, your family doesn't have, that's when you can use this method to start off the process.
Wow, interesting. I didn't know about it.
So I made this batch of curd. So it's so thick. I don't know if you can see it properly.
I can't see it.
It's too white, I believe, no?
Yeah, it is completely white. It is thick. It is looking very thick.
Yeah, so it does set very nicely, and I'm amazed with that science of making the starter with a chili.
That's really interesting. Small tips, and these tips travel when you start communicating. It is amazing to see, some amazing tips today. Very interesting.
So It's become a little cold, so I'm just putting them into the mixer. Okay, and I'll just show you. Very hot. So you can see that the leaves are crispier.
Dry and crispy.
Yeah.
And you have that little burnt flavor also, that roast flavor.
Yeah. And you'll see that the nuts are all roasted.
Oh,
Okay. So this you just put it into the mixer.
looks very mouth-watering. Powder. You just grind it and it is done. Ready to eat and serve.
Yeah. So you just grind it. Okay. Just grinding.
Oh, I can hear grinding.
Yeah. Oh, I forgot one thing. I forgot to put salt.
Okay. Yeah, I can't taste it now. That's okay.
Yeah, but yeah, salt.
It's looking very yummy. I think it's an amazing recipe. And
No, it
quick.
smells really good.
These are not only recipes. I think these are quick, fast tips and tricks. Making some little small healthy things at home.
So I've added salt. Okay. So as you can see, it's like a
It's a
fine
yummy,
powder.
and you can just put some little water in it and use it as a chutney also.
No, you can just store it in a glass jar or a container and use it as required. Like put it in rice, eat it with a little bit of roti or parathas or whatever. But I'm going to show you that the last recipe is that, as easy as it is, I'm going to put this curry patta chutney powder into the, homemade dahi.
Oh, that's really nice. This is raita.
This is raita. Okay. I don't need to put salt because salt is already added. Okay. And
just mix it and have. This is really yummy.
And you know what? I'm just going to add. My son likes bundi.
Oh.
Just to make it fun, crunchy.
But you can add some vegetables also in this.
You can add cucumber.
Grate some vegetables in.
Yeah, you can add cucumber. You can add some carrots, grated cucumber, carrots.
That's really amazing. So today we had very interesting quick jam that was really quick and healthy with honey and some almonds or nuts. And then we had paratha, which was coconut paratha with jaggery, and that also has option of making it, in some spices, regular spices. And then very interesting new tips. I have learned it today. I didn't know. Maybe people know about it. That you put red chilies and make it jamun first.
Green chilies.
Green chilies. Yeah, and jamun and milk. That can be used to make dahi further. And amazing curry powder, like chutney you can say, or powder, which can be used or with rice you can eat, with roti, and further you can mix in curd and enjoy it. So that was so nice, Shalini, and I really enjoyed the entire session with you, and I hope our all audience must have got some good healthy tips, especially for kids who are fussy, so you can quickly give them something, healthy bites. And that's what this show is for, Healthy Khayega India. And I think you solve the purpose where you give such tips that, and this is going live. And after this, I think millions of people will be watching this show on this video. And thank you very much for joining us today. Shalini Santosh, from Early Foods, that you have your own venture also for foods.
Thank you so much, Rajiv. It was really wonderful. And I really enjoyed the live session. And I hope these are ancient tips. This is not something coming from me. This is something our grandparents have done. I just felt that a lot of people have lost in touch with this knowledge. And I'm very glad that you've helped me pass on this message to our parents.
That's definitely, today a lot of people are watching after the show, so there'll be a lot of people watching. Even small thing. As you said, these are ancient things, and we will start practicing it. We are medium of communications, and we definitely through us, if people come to know through you, they come to know these small things which we used to practice, but maybe our new generation, they don't know much about.
They've forgotten about it. Yeah.
Thank you very much again, Shalini. It was lovely learning from you. Very interesting.
Thank you so much.
Is always very exciting. Thanks a lot.
You. Namaste. Bye.
Bye-bye. So this was our Healthy Khayega India show, which is another flagship initiative by IHW, Integrated Health and Wellbeing Council. We had an amazing day. This was the last session we had, and morning, third day, it was really amazing to see some of the stalwarts from health and nutrition, food sector talking about malnutrition and a lot of inadequate nutrition what we are suffering. You wouldn't believe half of our generation, new generation with children in our country is suffering from malnutrition. I'm not talking about hunger. I'm not talking about bad food. I'm talking about malnutrition. And this is the number, when we say half of the generation. A lot of companies, government is doing a lot of initiatives, putting a lot of experts on the job and trying to eradicate even hunger and problem of malnutrition. That's what this Bharat Nutrition Week is a medium where we bring top people from the country and from other international fraternity together and talk about serious issues, talk about the solutions, talk about various aspects, how we can help government achieve the target of Poshan Yukt Bharat and Anemia Mukt Bharat. Government has taken many initiatives. So our panel was really interesting. CEO of Integrated Health and Wellbeing Council, Mr. Kamal Narayan, took us through various aspects with other dignitaries. We moderated the sessions. And the another session which we had with Dr. Satish Kumar, he with other dignitaries talking about a lot of experts, how we can, make good food for the families, home, and how we can have affordable nutrition. Very interactive session. This was a panel discussion we had, and again after that we had another flagship program called Good Food, where we talk about good food and how people have taken initiative about good food, how renowned individuals, even companies taken initiative, a lot of startups, tips about good foods and food industry. Nikki Gupta, CEO of eWork, really interacted well with all the renowned personality, bloggers, influencers of food. How personally these people are putting a lot of efforts, making their recipes and small tips famous on internet, using internet personally, and benefiting millions about good food. And we people are really enjoying our flagship, another flagship event, Bharat Poshan Premier Quiz. We had many school kids with our host, Princey and Satvik, talking about a lot of new topics. Today we had anemia and people enjoyed it. You can see the scoring online on ISW Council page. We show live scoring also, and teams are really doing well. They need your encouragement. And if you want to see live again, till 7th we have grand finale. Tomorrow we have topic immunity booster. There will be a lot of new questions for kids. And Healthy Khayega India, definitely we have more chefs coming, more with home-based tips, recipe for cooking some new interesting things. This is tomorrow. We are starting. So tomorrow, day 4th, we're starting again at 11 o'clock morning, and we are talking about nutritious needs for working women, professionals, elderly, and especially people who are with special medical conditions, cardiovascular, diabetes disease they have, they're going through that, what kind of nutrition they need, and how they can protect themselves and delay these disease, cure even these diseases with good food. We have again Nikki Gupta talking with a lot of influencers on good food talk show, and Healthy Khayega India. Again, we have Chef Ruchira Home. A lot of interesting things happening next day on the 4th day. So thank you very much for. We hope you enjoyed today the entire session, and we'll see you tomorrow at 11 o'clock. Before that, I would like to thank from ISW artists, our supporting partner, MQ, WW Foundation, and Food, Drugs, and Medico-Surgical Equipment Committee, FOGSI, Wellbeing, World of Wellbeing, which is supporting our quiz program as is presented by World of Wellbeing, and Council of Indian Food Trade. Special thanks to them. And we thank our partners, special thanks to them, Shilpa Medicare, Hexagon Nutrition, and Cyrus, British Biological. Thank you very much, and have a very good, safe, and healthy day. Thank you.